وصحبه أجمعين. Thank you, Dr. Muhammad, for this introduction. And really, I thank you personally for the invitation. I thank the organizers really for this excellent organization of this conference, which is very, very important conference. And no doubt that it is being held in Medina, where we have Masjid al-Nabawi, where millions of people are attending every year in real mass gathering religious events every day almost. That we can see thousands of people are in this city every year attending Masjid al-Nabawi activities. And that's why I think it is very, very important to look into this conference, which is concentrating on mass gathering medicine, that our government, Saudi Arabia, is really heading at the front, really, in this field, because we are really looking at making the best healthcare system for our guests that they come to the country and the worshippers that are attending these prayers for the sake of Allah subhanahu wa ta'ala. So I ask Allah subhanahu wa ta'ala to reward all of us in the field looking for the best in medicine. My talk today, can you, I lost control here. I want the next slide. I can see here in the laptop it's coming, but here in the main screen is not. شفنا تمشي. In the laptop it is proceeding. I can see the next slide here, but it's not showing up there. لا هي بتتحرك هنا بس ما بتطفي. At the screen of the laptop, the slides are proceeding, but here at the front, they are not. هنا بتمشي بس هناك ما هي. Anyhow, I will proceed to just to show the importance of respiratory medicine and mass gathering medicine. I was telling actually that mass gathering medicine. Yes. So this is my talk, which is about respiratory medicine working plan during Hajj season. And I chose, of course, the respiratory part during Hajj because I think because first of all, I am a respirologist, so no doubt that I'm concentrating on respiratory medicine. And the second point is that I think the respiratory component in mass gathering medicine is very important. I can say probably mass gathering medicine has has a lot of components, but the three main components are the cardiovascular, the respiratory, and the trauma part. These are very essential parts of any working plan for any mass gathering events. You know the definition of mass gathering medicine, which is a specialized field of medicine that focuses on planning and preparation and improving healthcare management for events where large number of people gather in a confined area over a defined period. And these events really are very important, and all the organizers, they take care of the healthcare system during these events very importantly. In particular, our experience in the Kingdom of Saudi Arabia, and this part actually showed a lot of attention in the recent years, and we have good expert people in this field in our country that actually made these events super, and they really made a lot of even of publication about mass gathering medicine. So the kingdom actually is leading the boat here in mass gathering medicine. When we speak about Hajj, Hajj to Mecca is not the only event that are around the world. There are other events which they have a similar kind of. These are well known in Iraq and India and other parts of the world where they gather in religious events. But actually, Hajj is really, to me, and after looking into deep things, is totally different. And I think the numbers are more and more, and even the way people are behaving through are different, and the improvement actually in this regard in Hajj is really excellent and stimulating. So that's why I'm telling that our country is taking the lead in such events and in such development of healthcare systems in mass gathering medicine. The experience of Saudi Arabia is there and well known, and even we are taking also the expert people from other parts as we are in this meeting, inviting people from France and Qatar for sharing their experience to go together in the path through the development. Anyhow, we'll come back to our main issue, which is the respiratory medicine. The respiratory medicine in mass gathering events and situations is very important and should be one of the main issues that looked at in any mass gathering situations. The other general health risks are important, of course, which should be also considered. My view here is to concentrate on the respiratory health. The main issue about respiratory challenges at mass gathering medicine are related to airborne transmission of pathogens, the respiratory illnesses, which are linked to crowded environment. There are some environmental factors which are related to respiratory system, related to dust, heat, and pollution. And there are personal factors for some who are attending these events, that they have already pre-existing respiratory conditions. And that's why today I will have 3 presentations to you in regard to respiratory system and the mass gathering medicine. The first part is the working plan that I think is important during Hajj. So if we start with this issue, we'll go with the infections part. And the main important infections that should be considered in mass gathering events, and particularly in Hajj, are the viral infections and the bacterial infections, which are really constitute major parts of the challenges that our EMS system in Hajj and the whole healthcare system really face a lot of challenges about infections during Hajj, and we should always make this issue like an important part in our healthcare development. The viral infection constitute the influenza, COVID-19, even the MERS, cough virus, and other even influenza-like illnesses that they actually spread quickly in mass gathering situations, and they should be always considered as an important part that we should develop to control and the improvement in it. The bacterial infections are there also that we face, and some of Hajj people are suffering from bacterial pneumonia due to stress and others, and even tuberculosis that has been reported during Hajj period. And I will give you some concerns about TB during Hajj. So always the preventive strategies should be there in any working plan during Hajj. And we always try to apply this during any Hajj season. The first part are the infection control, the usual infection control measures, which include hand hygiene, face masks, and social distancing. Very important part that we always try to encourage during Hajj. Vaccinations is very important part of those who are attending Hajj, and there are always updates about what are the best vaccinations that those who are intending to attend Hajj that they should go through. So the vaccinations are very important and available, and they actually constitute very important part of prevention for during Hajj. The awareness and medical and education to those who are attending Hajj is very important. Education in general is important, really. So always this part should be taken by in consideration in any working plan before Hajj, that we should always make sure that we have the best kind of awareness programs so that people, they know what are the preventive measures they should go through and what are the diseases and so on. So awareness part is always there in the working plan and should be taken in consideration. And this is, we see every year before Hajj, like high grades of awareness programs that are going through. And I think we should go more and more improving these awareness programs by campaign, and even now by using the social media, spreading all kind of important information to those who are planning to attend Hajj. About TB, actually, I think as a respirologist, we always speak between us in respirology science about TB in Hajj and how far this is that should be taken in consideration. Unfortunately, TB is a slow disease and a chronic disease, so it is not easy to see an outbreak or something like that during Hajj. Because if you get, if somebody got the mycobacterium organism into his lungs, it will take months or weeks to develop the disease. So it will not be easy to know how much people are going through the Hajj period. But it has been a concern, because actually there has been some papers published from Saudi Arabia showing actually that there are some of the people who are coming from different parts of the world are carrying the mycobacterium organisms. And when they come to Hajj, they actually may get other people infected, specifically that there are some people who are having very mild symptoms. The problem here is that there are some countries outside the area here which actually have what we call as multi-drug resistant and the like even total resistant HDR organisms that they don't like respond to the usual anti-TB therapy. So our country so far is not one of the countries that carrying high rates of these resistant organisms. And if people start to come from outside the country and spread these organisms here, that will make our local situation about TB control and the local TB control programs difficult. However, the efforts here, they noticed what we are worrying about, and there are a lot of good efforts that we see now trying to control this issue. I think there has been some reports about more ultraviolet light around the areas, around the mosques, the two holy mosques, because the ultraviolet lights has been shown to actually can make these mycobacterium organisms more weak. And even by controlling the ventilation in the areas where we have a lot of crowds, we can really also control the TB infection. But this working plan during Hajj should take in consideration TB, and always we should try to improve the TB control issues. So far, it is not of the requirements to look at the TB in all people who are coming for Hajj, like at a routine chest X-ray or routine screening system. But I think things are under studies and under research, and I hope that the future working plan in Hajj will take this part in consideration. The other things that should be taken in consideration of during Hajj and the working plan in respiratory system is the international cooperation with other organizations and other health bodies outside the country, so that the interaction can give us more feedback and more expert opinions. And always this actually is part of our MOH programs here, taking in consideration the interaction with WHO and CDC. There is very important issue about regular respiratory surveillance during Hajj, and ongoing efforts are always there because, as I told you, respiratory diseases are on the top of diseases that should be considered during this period. The respiratory health emergency plans should be included with all EMS systems, and this is part of it. But we should always think about the respiratory equipment, about the special respiratory care training for the healthcare providers, because, as I told you, respiratory diseases are very common during Hajj, and all the healthcare providers and all the systems that are dealing at the front with our guests should take in consideration the respiratory part on top of the list. There are some efforts about more respiratory isolation space and preparation for outbreaks, because there is always, alhamdulillah, wala qaddar Allah an yakun outbreaks during our Hajj thing, but there are always preparation for having a similar training process before Hajj in case of the respiratory problems are rising, that we should know how to control it, and we are at the front prepared. So any working plan during Hajj should include how we get prepared for outbreaks in case of outbreaks of respiratory diseases. There are issues about availability of respiratory healthcare needs. As you know, during Hajj, it is not easy to transport equipments here and there. So always the working plan during Hajj should include like preparing all the respiratory equipments all over the centers, and should be ready there. And even that the excellent transportation methods should be actually taken in consideration in case that we need more respiratory equipments, because it is not easy to request respiratory equipments in all hospital and distribute it if you need it. It should be there in the stores, and the amounts and the preparation of these equipments should be on the top. In addition to the medications, there are certain respiratory medications which are very important, and we should make sure in our working plan that we have enough stock of these medications. There are just at the end let's speak about future directions, which are promising and to be included in the working plans during Hajj. Use of AI and data analysis in tracking disease patterns, especially cough, for example, or respiratory distress, or oxygen saturation. So if we can, using this AI technology or special gates or cameras in detecting people with respiratory diseases during their flow through the mosque or flow through the al-masha'ir, this will be very important in the future, so that we can recognize who are the patients that they need help for any diseases, and in particular the respiratory diseases. If we see patients who are suffering from severe respiratory distress, there should be alarm, or the oxygen saturation is low, there should be an alarm. So this, inshallah, in the future, we will try to suggest it in the working plans of Hajj, in particular to the respiratory side. The infrastructures actually are always under development, always before Hajj. And we always look to improve the systems in the infrastructures. As regard to respiratory system, there are now suggested some respiratory capsules that can be done for if a patient is discovered to be infectious and he is in a place where a lot of people are around him, you can easily put him in these transfer capsules where he cannot infect others during and also the gates. There are special suggested gates that they can pick up patients with respiratory distress or patients with not only fever. There are gates now which can pick up the febrile patients, but there are suggested gates where it can pick up patients who are suffering from respiratory diseases like cough. For example, in TB, patients are always coughing. So if we notice somebody coughing, this might be an alarm to screen such patients. Or if somebody has severe respiratory distress and he cannot breathe, the gate or the cameras may pick him up, and that patient can be picked up early. So these are future things which are dealt with, and actually Ma'had Khadim al-Haramain al-Sharifain in Mecca is dealing with these future technologies to add on, and we always try to give them suggestions as experts in the field in this regard. And as we see now, our colleagues are sharing with us their experience that they developed in these institutes, which are promising for the future. So this is actually what I can add on in the working plan of respiratory diseases during Hajj. And in conclusion, there is a strong interaction between Hajj and respiratory medicine. There is a major need to improve respiratory healthcare during Hajj, always, although we are really at the front, but still to keep the front and to stay on the peak, you always have to develop yourself and make more and more improvement. So the improvement should be a goal. And the respiratory working plan during Hajj needs cooperative measures with the global health efforts and other preventive measures across the world. And of course, we always stress on research and future directions in the field. Thank you.
Thank you very much, Professor Badr. We'll leave the question till the end of this session. Our next speaker is Professor Saeed Al-Ghamdi. He's a leader and experienced vascular surgeon, Deputy Chairman, Technical Supervisory Committee in Hajj from 2004 till 2017. He's an associate director of training program in the Saudi Council for Health Specialty. Dr. Professor Al-Ghamdi will talk about challenges and opportunities for Hajj, for healthcare professionals serving during Hajj.
السلام عليكم ورحمة الله. Can I take my time? I'm going to talk about the challenges and opportunities for the health professional during Hajj. As you know, Hajj is the most important gathering in a short period in a very narrow space, which creates a big challenge for the health workers. It is a great responsibility for the health worker to participate in this challenge and get their opportunity to get the benefit. So these challenges and the health workers will require to be medically expert. He have to be spiritually devoting and adaptable to these challenges. So the objectives of my presentation to analyze the nature of these challenges during Hajj and explore balancing duties with spiritual aspiration and Islamic values, and elaborate on compassionate care and ethical strategies. Among the challenges are the physical challenges, physical and logistical challenges. In Hajj, you will face a high volume and intense environment, high volume of people, and this will reflect those who require the medical care. And on the same time, we have an intense environment, the temperature, whether it is in the summer or winter. In summer, you will get heat illnesses. In the winter, you will get the opposite, cold. In my period of working during Hajj, I faced the highest temperature and I faced the lowest temperature. The highest temperature, lot of heat strokes, and the lowest temperature, we have even a lot of cases of hypothermia, because during the night of Muzdalifah, people, they don't sleep inside tent, they sleep outside. And if there is rain, this will add to the coldness. So I have faced both. The medical conditions, there will be a variety of medical conditions. Most of them are minor, but you have to expect, or the health worker have to expect a serious condition which require a good knowledge, good skill, and quick management. Otherwise, the patient will be lost. The resource limited setting. The resources are excellent during Hajj, really. But the patient might be taken to a place with low resource. For example, you get a patient with myocardial infarction to primary care center. Then the resource will be limited. The coordination and the crowd control. You will face a lot of crowd, which will restrict the transportation of the patient from the place where he is to the hospital, or you will face the crowd which will prevent the transportation of the resources. So these are the logistical and physical demands. The emotional and spiritual stress. When a health worker goes to Mecca to work, he is putting in his mind that I want to do Hajj. Almost all of them. The Ministry of Health are preventing and not allowing you to do Hajj. But some of those who work in Hajj, or even around 50%, they move with the pilgrims. So in the day of Arafat, they go to Arafat. So they feel, I'm in Arafat, why not to do Hajj? Then after Arafat, he goes back to Muzdalifah, then Mina. So it is a chance for him to do. So if he want to do, it is a chance for him to do, but not to prevent him from doing his main job, which is the medical service for the pilgrims. He should not wear ihram, because ihram will prevent him from working. And the restriction in the Ministry of Health is don't wear ihram. But they did not say don't do Hajj. So I'm not now announcing for you to do Hajj, but you can do without affecting your service. By the way, I worked more than 16 years in Hajj. Alhamdulillah, I was having the chance to do Hajj in all except in 2 seasons. So these 2 seasons, I did not do it because I faced a lot of work. I faced that I have to be out of Arafat on the day of Arafat. So I did not do it. I did not affect my emotion that I should do it. You remember that you are there to serve the guest of Allah. So when you serve guest of Allah, what do you expect? You are expecting reward from him. Is it? Yeah. Providing compassionate care. When you care, when you treat the pilgrim with empathy, this is one of the things that you have to have it. It is a challenge, really. How to do your hard work and how to be empathy with the person. It's a great challenge, really. Navigating personal spiritual journey. There, it is the best days in the year. The 10 days of the Hijjah, it's the best days in the year. So there you want to do fasting, you should not do it. Why you do fasting and you make your job affected? Some of people, they want to make the prayers in the Holy Mosque. No, do it in your place of work. You will get reward for that because you are serving the guest of Allah. What are the solutions for these challenges? One of the solutions, deliver effective health care during his Hajj. You have to respond to the high patient volume. So you have to be quick in work without neglecting the very important cases. So this will require knowledge, will require skills. Work in resource limited settings. Sometimes you have limited resources in the primary care center. So how to deal with these resources, how to be very effective in transporting once you feel that your resources will be affected. Manage the common health issues. There are most of the cases are simple cases. Common cold, muscle pain from walking, dehydration, which will require just only drinking, and stay physically and mentally prepared for any problem, for any disaster, whether for you or for the pilgrims. As example for that, death of any relative. My father, rahimahullah, he died when I was during Hajj duty. So it is a stress for a person who have his relative died or he had any problem while he is there during the work. How to adapt to logistic with flexible healthcare solutions. Utilize the temporary healthcare units. Most of the pilgrims from different countries, they have their doctors with them, they have their clinics with them. So these have to be utilized. And also there are mobile teams also have to be utilized to reduce the load on the primary care centers and the hospitals. Coordinate with authorities. This will help for transportation of patient, transportation of resources, managing the resources disparities. Some of the places, they have good resources. Some are less resources because of too much crowd that overwhelm the resources. And there must be a coordination between them and developing an emergency plan in case of any disaster or in case of any shortage of the resources. Align healthcare work with spiritual goals. So how to align that? So you do your work, be ready to have support for your colleague so you can go for prayer, or even you can do the prayer inside the clinic or inside your ward, and your colleague will do the same. So you have to align these together. Embrace pure intentions. So niyah. Without the intention, you will not get reward. So put in your intention that you are serving the guest of Allah. So the reward will be counted for you. Find deeper meaning. Find deeper meaning that you want to get a lot of reward from Allah, and also to get good experience during your work during Hajj. Strive for excellence. It's your time to feel and to increase your knowledge, increase your skills to reach to the excellence. Provide compassionate care to the distressed pilgrims. Some of the pilgrims, they lost their families. Nowadays, it is easy to find them because of the band. But previously, it was difficult. Some of the pilgrims, they don't find their families till the last day of Hajj. And you have to be emotional with them. Navigate spiritual burden for them. For those who cannot, for example, cannot go he's already, for example, went to Arafat and he's back to Mina and he cannot go and throw Jamarat. So you have to navigate and allow somebody or allow this patient to give permission to another one to go and throw for him Jamarat. So these one of the facilities that are supporting or to be compassionate with the pilgrims. Maintain emotional health. Support him. You are doing your Hajj nicely. Already you did Arafat, so don't worry about the remaining. Integrate spiritual practices. Some of the patients who are in the hospital, admitted in the hospital, and his status or his condition doesn't allow him to go to do or to stay in Arafat, day of Arafat. So in this issue, there are facilities to take him to Arafat and stay in Arafat till the sunset. And these are one of the things to integrate the spiritual practices for the pilgrim. Navigating the ethics and cultural sensitivity. Yeah, we have to respect the autonomy of the pilgrim. We have to respect what he wants. Some of the pilgrims, they came to die in sacred place. They want to die in Arafat. So if he is having a problem and you feel that you need to resuscitate him and he is refusing, don't resuscitate me, I want to die, you have to respect him. Address diverse cultural backgrounds. Some of the pilgrims from different cultures, you will face difficulty in communicating with them. So in this case, one of the solutions is to provide or to recruit different nationalities in order to have each nationality of pilgrims with their doctors, with their services, and this will help them handle complex situations. The complex situation, if a patient is having a serious problem and he is unconscious, comatose, how to deal with it, whether to resuscitate, not to resuscitate. So these will require an ethical issues. I'll discuss it. Uphold ethical integrity. What is the best of the interest of the patient? You go with it. If he is comatose, the best of the interest of the patient is to resuscitate him, is to support him. So you go with it. One of the things is to have the training for the professional, for those who work in Hajj. Provide specialized training about Hajj, about how to prepare for disaster, how to make the triage, how to deal with the infection, how to do the hygiene, how to manage the common conditions, promote the continuous education, and prepare for any public health emergencies. Among the things that will solve the problems or the challenges during Hajj is to foster the teamwork. By promoting the teamwork, you and your colleagues work together, all the hospital work together. So this will help you, will reduce the physical stress in you, will reduce the emotional stress in you. Coordinate the healthcare delivery by dividing the work between you. The work during Hajj is not easy. It is physically difficult. It is long time. You are working 12 hours at least, and you are facing a lot of cases. Some of the teams are working under the sun. So it is also the weather is difficult for them. The poor resources and knowledge. The resources is one of the most difficult thing in Hajj. One of the seasons we have around 2,000 heat stroke came, and that was in the year 2015. 2,000 cases came to, most of them came to one hospital. You can imagine how much resources will be affected. The gas, the oxygen cylinder almost completed. And the other hospital, which is nearby, their oxygen cylinder is still maintained because they did not take the patient to them. The seriousness of the patient made the Red Crescent to bring them directly to this hospital. So there was a very difficult situation to bring oxygen cylinder from the other hospital. So keeping a good pool of resources is very important. Collaborate for effective crowd control. This will require coordination with other authorities. Establishing support system for healthcare worker. Develop support network. توعية دينية, there the religious support. Incorporate reflection and prayer. So whether the health worker utilize his stay in Mina or in Arafat, praying for himself while he's working. It's not difficult. It's not difficult to continue to ask the patient to pray for me and share experience with the others. If you share experience, you will reduce their physical illnesses and you will reduce their emotional illnesses. Managing emotional health. Maybe you noted that last Hajj, one of the health worker, her father died. And the minister himself, he went to say, to convey condolence to her. And he asked her, would you like to go to home? She said, no, I want to continue. And one of the management for that, he asked, where's your clinic? Where are you working? Because she was working in primary care center. She said, that is my clinic. Then he ordered you name that clinic by her father. This is a good example of how to manage the emotion. Strive for excellence. So by pursuing perfection. ما دخل الإحسان في شيء إلا زانه. So perfection is it's an issue. You will satisfy yourself, you will satisfy the patient. Embrace Islamic values. Mercy, kindness, compassionate, empathy. All of these are Islamic values. Achieve professional and spiritual goals. Your goal, keep your goal that Allah will love you. Remember that Allah loves that whenever any of you does something, He does it with perfection. إن الله يحب إذا عمل أحدكم عملا أن يتقنه. And focus on the quality. Plan and prepare for healthcare challenges by engaging in comprehensive planning. So the plan is already made, but some of the plan need to be changed during any incident. So keep also giving report, give feedback to the management. Anticipate challenges yourself by support of the administration and give feedback also to them to change their plan. Learn from previous experiences and put it in the plans. Promote continuous learning, and all of that will make the challenges solved. Respect the patient privacy and the cultural differences. The patient or the pilgrim is having dignity, so respect this dignity. Give him trust and prioritize the safety and avoid harm. Do the best for him. Don't do any harm to him. Emphasize compassion. Promote time management and ethical practice. The most important of the time management is the punctuality. So anyone or a health worker have to be punctual. He have to attend on time. He should not leave before the end of time. He should not leave while he is having a patient until he finish it or endorse it. Embrace responsibility. You have to feel that you are responsible. Maintain honesty. Be honest with the patient, be honest with yourself, be honest with the administration. And uphold the principle of autonomy, beneficence, non-maleficence, and justice. So respect what the patient wants. Don't do the best thing for him. Don't do any harm for him. Beneficence means جلب المصالح. Non-maleficence, دفع الضرر, and justice. You remember in the last year or last season of Hajj, a lot came without permission, بدون تصريح. And all of them have been managed as if they have the permission. This is a kind of justice. In conclusion, the Hajj healthcare is both serious responsibility, and spiritual opportunity. Flexibility and medical skills are essential for managing many patients effectively. Compassionate care helps support anxious pilgrims and maintain emotional strength. Understanding cultural challenges require respect of patient choices and autonomy. Ongoing emergency training is vital for preparedness during health crisis, and pursuing excellence in care benefits programs and align with the Islamic values. Thank you very much.
Thank you very much, Professor Saeed, for this interesting presentation. We'll continue, actually, and after this lecture, we will take questions. Okay? Our next speaker is Dr. Ahmed Al-Afghani. He's a consultant to internal medicine and adult infectious disease, Prince Sultan Armed Forces Hospital in Al-Madinah Al-Munawwara. Dr. Al-Afghani will talk about communicable diseases transmission risk in mass gathering. You can start.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thanks, Dr. Muhammad. I'm honored to be here with you all. I would like to start with our first lecture as infectious diseases specialty, sharing their knowledge with the mass gathering issues. First, we'll talk about communicable diseases, transmission risk, and mass gathering. The lecture is appearing. Oh, yeah. So mass gathering is an important event where a lot of benefits are exchanged or organized events are achieved while hosting extraordinary numbers of populations. To have such events done in a successful way, we need to maintain healthy environments and designate risk measures for communicable diseases for further appropriate actions of prevention and management. First, we have to talk about an example of a chain of infection. As you can see, it's a start with the germs and where the germs living and how the germs get out of the living host and the germs how get around or mode of transmission and how the germs get into the next host and the next sick person or susceptible host. Also, to continue with the modes of transmission, this includes the direct contact transmission, which is from person to person. Here, the agent is transmitted by physical contact between two individuals, such as touching, or droplet sprays, for example, infectious respiratory diseases and gastrointestinal disorders. Other methods include indirect contact transmission, which involves inanimate objects called fomites. These fomites are a media where the contaminated pathogens from an infected individuals or reservoir. For example, when an infected person infect his surroundings like hand doors and the next person come and touch that infected object or fomite, then he acquired the infection. The other mode of transmission, which is vehicle transmission, the term vehicle refers to a transmission of pathogens through a media like water, food, and air. Water contamination through poor sanitation methods lead to waterborne transmission of diseases. Waterborne diseases remains a serious problem in many regions, with the WHO estimate that contaminated drinking water are reasonable for more than 500,000 deaths per year. Similarly, food contaminated through poor handling or catering or storage can lead to foodborne transmission. Now, dust and fine particles known as aerosols, which can float in the air, can carry the pathogens and facilitate the airborne transmission of the diseases. Droplet transmission, although considered as contact transmission, longer distances can be a vehicle transmission. For example, as mentioned by our colleagues, tuberculosis is often airborne disease and transmitted through airborne. So because TB is a highly virulent bacteria, and as mentioned by our colleague, it's a silent disease and take time to develop a disease. It's need high precautions like negative pressure rooms and special masks like N95. Now we can expect the next mode of transmission by this picture, which is vector transmission. Diseases that can be transmitted by mechanical or biological vectors, which is a living animal or arthropods, typically called, that carry the disease from one person to another. Mechanical transmission means that the vector itself is not getting the infection. It's just transmitting the infection like the fly. While the biological transmission, that means the vector itself, it's getting the infection and transmitting the infection to the other person. These are the two most hotspots for mass gathering continuously. The Holy Two Mosque in Mecca and Medina. So in Hajj season, the annual Muslim pilgrimage to Mecca, Saudi Arabia, is one of the largest mass gathering events, with estimates between 2 to 3 millions from different countries, over 185 countries. The presence of these large numbers carry a high risk for transmission of infectious diseases, particularly respiratory and gastrointestinal diseases. In the past, we used to have outbreaks of cholera during Hajj season, which made the attention of public health and Ministry of Health authorities to take infection precautions and measures to decrease and minimize these outbreaks. So these were starting by having excellent sanitation of water condition in Saudi Arabia. And nowadays, no more cholera outbreak for the last decades in Saudi Arabia, alhamdulillah. Similarly, invasive meningococcal disease has been forming outbreaks during Hajj, especially the last one was in 2000. And strengthening the vaccination program helped in eliminating the outbreak of meningococcal disease, even though we still having sporadic cases, but not an as outbreak. So the last, no more meningococcal diseases been reported in Hajj since 2006 for the serogroup that caused the outbreak in 2000. Now, the prevalence of respiratory symptoms in overall populations of pilgrims, including 50 to 93%, with pneumonia as a leading cause of admissions in Saudi hospitals. let me go through some studies that can explain the transmission risk of these diseases. A retrospective study in 2022 were conducted to review a viral etiology of severe acute viral illnesses among admitted patients during 2022 Hajj period. Resulted in most frequent detected virus, which is COVID-19 with 15% and influenza 12%, and only one case of MERS-CoV was among a citizen, not a Hajj or pilgrim. And total of 14% or 27 patients died during the follow-up period. Mainly age was playing a major role in the mortality. Another study on reviewing diarrhea at Al-Hajj was published in 2015, showed a prevalence of diarrhea ranging from 1 to 23% in 14 cohort studies, including 263,000 pilgrims from various countries between 2002 and 2013. E. coli was the predominant pathogen, isolated from pilgrim by PCR. Different strains of E. coli, we have like enteropathogenic, enteroaggregative, and Shiga toxin-producing E. coli. Among persons infected during 2011 and 2013 Hajj, hospitalized in Saudi hospitals, the pathogen were responsible for enteric infection were mostly bacterial. And the prevalence of Salmonella species was 11%, and where diarrhea associated with E. coli ranged between 1 to 8% accordingly. Another systemic review of epidemiological difference in Hajj acquired airborne infection in pilgrims arriving from low and middle income versus high income countries were published in 2023 and comprehensively assessed the burden and epidemiological patterns of airborne infections among Hajj pilgrims from low to middle income countries and high income countries. The findings showed that pilgrims from both regions are at risk of acquiring airborne diseases during Hajj. More Hajj pilgrims from high-income countries seems to develop viral respiratory infections compared to those from low and middle. However, such a difference did not seem to be existing for the bacterial respiratory infections. And this was attributed to the vaccination program. There was some deficiencies in the high-income countries like Europe for vaccinating routinely or pre-Hajj or pre-travel clinics. The finding highlight the need for improving vaccination coverage and effective infection control measures to prevent the spread of airborne infections. A wise man once said to me, are we tired from COVID or we are tired of COVID? And now that's because we have repeatedly during the last couple of years about COVID. Whenever we have a conference or so on, we will have a COVID to be mentioned. But again, we will not be tired of COVID. We may be tired from COVID, but not of COVID. So how the pandemic shaped the world? Largest religious gathering in 2020, which is Hajj. The WHO declared the need for long-term collaborative and dedicated public health initiatives to achieve global control of COVID. And despite the initial announcement of deferment of Hajj from the Saudi government, measures taken by the government and the timely decision allowed the Saudi to conduct a reduced Hajj in that pandemic year, which is 2020. The Saudi Arabia Ministry of Health developed a 5 eligibility criteria for all potential candidates to apply and perform Hajj, which is age between 20 to 65 and not having any high-risk chronic diseases and not to be obese or pregnant and having a negative PCR. Now let's talk about the current situation. Any new challenges in mass gatherings, infectious disease will always be contributing. We have a new viral infection called Mpox, which is used to be known as monkeypox, is now a new communicable disease that make a public health emergency of international concern as announced by the WHO. So to take home messages, communicable diseases are major concern in mass gatherings. Mode of transmissions are different and causing different communicable diseases. Respiratory viral infections are accounted as most common cause for communicable diseases in mass gatherings. And understanding the transmission risk help in taking actions for preventions and management of communicable diseases in mass gatherings. Annual assessment of common communicable diseases with help of global organizations like WHO to evaluate new infections like Mpox risk of transmissions in mass gatherings. And thank you.
Thank you very much, Dr. Ahmed. Any question, please? For Dr. Ahmed, for Dr. Saeed, for Dr. Badr. MashaAllah. Excellent, Allah. طيب, we'll take like 30 minutes for a break, for breakfast, and we'll come back, please. Thank you very much. نكتيب كده ايوه تسلم شكرا يلا بسم الله الرحمن الرحيم. We'll start our second session now. Our next speaker is Professor Badr Al-Ghamdi. He will talk about patients with chronic respiratory disease in mass gathering situation. ممكن تحط السلايد يا شباب؟
بسم الله والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. The second presentation for me today is about those patients with pre-existing chronic respiratory diseases and their situation during mass gathering events. These are actually patients that I face every day in my clinic. And when they go and attend these events, they tend to run into troubles. Patients who are already having a pre-existing disease. So always we have to consider that patients with asthma, COPD, bronchiectasis, and patients who are on oxygen therapy related to chronic respiratory failure. They would like to enjoy attending events. Yes, they are patients, but still they would like to go and take Umrah. They would like and go and pray in the two holy mosques, Masjid al-Haram and Masjid al-Nabawi. And some of them, of course, they would like to attend Hajj or sports events where a lot of people are around them. Should we allow them to go there or not? This is a common question and a common problem that we always face in our daily practice as respirologist, as a chest physician. I see these patients in my clinics, and I see them always. They ask me whether can we go for Umrah, can we go for Hajj, can we travel to some place like Paris or Qatar and attend these sports events or not. There is, of course, always a problem, like there are problems that we always have to keep on mind for these patients before we allow them to go. And they should always be prepared and ready and listen to the medical education things before we can allow them to attend. And that's why it is important also for other healthcare providers to know what are the precautions for these patients if they would like to attend events or they would like to attend Umrah or Hajj. The commonest are asthmatic patients, of course, because asthma is the most common chronic respiratory disease in the whole world and also in our country. It constitutes about 10% of the population might be asthmatics. So always we should really be aware of these patients and be ready for giving them the advices and the recommendations in attending Umrah or Hajj or other mass gathering events. There are certain outlines that should be kept in mind. The first thing is about the meditations, because they should be maintained on meditations and they should have available ready meditations with them. This is, of course, clear, and we always advise them to have enough meditations during the travel. Specifically during Hajj, for example, it's hard to find meditations. There are no available pharmacies around, and it is difficult to take transportation and bring your medications if you run out. So meditations are very important, and we should make sure that these patients are having their meditations enough stock for them for the whole period. I was attending Hajj this time, alhamdulillah, sallallahu al-qabul, and I found actually that it was real because I had my own meditations as well. The usual meditation, aspirin and things. I was just thinking that if I lose these meditations between these millions of people, how easy I can retrieve them back. It is not easy. So always keeping the meditations and enough stock before you attend these events is an important issue. Another point that they should know, these patients, that during these events, usually individuals, they need to move around along the mass gathering ways and events, and they may face some limited mobilization, and they should be keeping this point in mind that they should be aware and they may need help during the attending that offense. The symptoms that they have should be also kept in mind, because actually the symptoms might also interfere with attending the mass gathering offense. Imagine if somebody has chronic cough and he is always coughing, and he starts to cough severely within while attending Tawaf or Umrah or even the stadium during the sport events, coughing all the time. These symptoms sometimes are not readily acceptable by the people around him, and he should be aware of this and whether how to protect himself in these difficult situations. Some patients may need special care, and they should be able to know how they can have this special care during the attendance of the event. And some patients also may face sudden change or worsening of their chronic symptoms. And again, they should know and they should ask how they should like behave and how they should manage such change, and whether they have like on-demand medications for the change, like the self-care plan, for example, in asthma. I will speak more about this. I will start by one disease, because they are not all the same. So if we start with asthma and attending mass gathering events, we know that all patients with asthma, they have problem with hyperreactivity. Means hyperreactivity of airways means that they can face certain changes during the event according to asthma triggers. If the patient started to face some triggers during the event, these triggers may actually make him worse and may lead to acute flare-up. So acute flare-up in asthma is very, very common. And actually this is the most characteristic feature of asthma, is that it can suddenly change due to exposure or trigger. So the patient should be aware of this, and they should know, like in the background, what are the triggers that he should avoid, because each patient actually has an individualized triggers for him specifically. Some patients actually might be having a trigger from Bakhur, for example. Another patient might have a trigger due to cold weather or change in the ventilation. Other patients may have certain irritants that may face during tawaf or sa'i, and he should be aware of it. And the exercise. For example, you know, during sa'i, we have what we've called is raml, that the patient actually should, according to the sunnah of the Prophet ﷺ, should do some like exercise during the sa'i. If the patient have an like exercise-induced asthma, he should have the warning that he should not. So it is very important to have good awareness in the patient background, especially the asthmatics, of what are the triggers that they should avoid. The smoking, another smoking issue, although alhamdulillah, most of the areas in the holy mosques and Hajj and smoking is prohibited. But if he is attending a sport like a stadium, some people might be smoking there. He should be aware of that he should avoid smoking. Bakhur, for example, also a lot of gatherings during social gatherings it is a trend here that they put Bakhur around, and the patient may have trigger from Bakhur, and he should be aware of this. And he should be, actually, I will speak more about Bakhur and incense when I speak about the two holy mosques and what are the things to avoid there. But the main point here is that the patient should be aware of his triggers, and he should avoid the triggers as much as possible. A common question is that he will wear a face mask. Unfortunately, the usual face mask sometimes cannot protect the asthma patient from the triggers. Because the usual face mask is actually intended for infection control and things. It's not intended to control the chemicals and the irritants. You need special masks to control such things. So the usual face mask does not protect the asthmatics from the triggers. And another very important point is that actually sometimes the patient may need more medications in case that he had more symptoms. So the stock should be available, because some patients may run out of the inhalers that they have, and they had only one inhaler, for example, and they don't have another one. So in such cases, that the patient should be prepared with enough stock of the on-demand medications that should be ready. The point, another important point to the medical healthcare providers is that they should have such medication ready always in case that they face such patients, because they might need immediate inhalers or nebulizer to relieve an acute event. So bronchial asthma actually is a problem, especially when the patient is attending Hajj and Umrah. There was one study which spoke about asthma during Hajj and Umrah and how many patients and so on. And actually, there was high rate of patients that they faced with acute exacerbation of asthma. In one study, it was about 18% of patients that they faced with EMS are asthmatics. So it is an issue, it is a common problem, and we should be aware of it, and we should be ready in the EMS emergency rooms and with EMS teams around Hajj and the two holy mosques of how they should manage such patients. Because this is if the training and the management of acute flare-up in all healthcare providers during these events of asthma attacks is very important. The usual recommendations for asthmatics, if we want to list them in a quick list, what are the general recommendations for asthmatic to attend an event where mass gathering issues is there? The first one is that the patient should have a pre-event medical checkup. So he should visit the doctor and make sure that his asthma is well stable and make sure that he has enough medications. And some asthmatics, actually, I was giving them a warning not to go for Umrah. The patient came to me asking, I will go to Umrah next week. I just actually checked the patient up. He was not ready. And I told him, please hold it and postpone the visit to Umrah or any social gathering events till you are more stable. And we give them medications, we made them ready. Vaccinations, for examples, we give them action plans. And there is something called asthma control test. We make sure that we go through the asthma control test and make sure that his patient is under good control. Usual figure is that it should be above 20 of the asthma control it means that the patient is not ready and he is not under good control and he is not stable and should not go for Umrah or Hajj till he is under better control. So the visit before the event is very important and will make sure that the patient is under good control and enough medications and he should know what to do. So the visit and checkup is very important, and the healthcare providers should be ready to know how to go through the assessment and make sure that they will give the proper advice for the patient to go or not to go. The asthma medications I spoke about, the relievers, the controllers, the patient should know which is which. Whether you will need an asthma label for the patient during the Hajj or not. This is what I was actually speaking about, the high-risk groups and whether we should label them during Hajj or not. I think there has been a concern about this, about the privacy, about some patients, they don't want to expose such clinical status. So he doesn't want to know that everybody knows him, that he's an asthmatic and you are labeling him. Some patients, they have the rights if they are refusing to be labeled. So asthma label, it is according to the patient himself, whether he likes it or not. But the recommendation is that such patient might be, especially if he's unstable patient or a patient with severe triggers, that he can go into severe life-threatening attacks. And in case that he got the trigger, that you may have to label such patient and give him special label, and the healthcare providers should always look for such history or labels so that they know, like somebody during Tawaf or Hajj dropped due to severe respiratory distress. Sometimes we don't know what is the cause. However, if the patient is labeled or there is an issue that this is an asthmatic, the healthcare providers might find it more easy to manage. The protective measures is always advised, but as I told you, there are problems with the protective measures and how much and which masks they should have, simple or N95 or other kind of masks. It is sometimes not easy to have all the protective measures around, especially for asthma. The allergy label is also advisable if the patient has specific allergy to certain food, for example. If he drinks or if he eats egg, for example, he will have the acute attack. Such patients should be labeled so that they will not give him such like allergy material. Always the patient should be advised to seek help early before they are in advanced stage. Some asthma, I know that they will try to, because they don't want to disturb the people around him, and he's suffering, he's coughing, he's having some problem with shortness of breath, but he keep it secret and does not disclose that to his family or his colleagues till the last moment. And this should not be the case. All asthmatics should be advised to seek help early so that it is not in the severe final difficult to control attack. And the education part is very important. So this is about asthma. We move next to about COPD. Asthma, I'm sure if I give you more and more lecture about how to go through asthma and the management and how to take care of an acute attack, these are important points in the training team of EMS. I'm sure most of our EMS teams are aware and being trained for that. If you are not trained of how to face an asthma attack in the field, you should be able to go through the training process. So more and more might be needed about asthma, especially that it is a very common disease. And I told you a lot of patients you will face if you are in one part of the EMS teams in the two holy mosques or Hajj or Umrah. So the training should be the top training on how to face an acute asthma attack. The COPD is less common. As you know, COPD is due to tobacco smoking or other air pollutions. And alhamdulillah, tobacco smoking in our area is not very high. It is in some areas, unfortunately. But what I mean, if you compare the prevalence of COPD and asthma, the COPD prevalence is much less, but still it is a disease that is actually getting more rising in the community. And it is different from asthma and might simulate asthma, but it is different, and the healthcare provider should know how to recognize such disease, because it might be difficult to know whether or differentiate between asthma and COPD in adults. But the issue about COPD is that although it is less common, but the exacerbation of COPD tends to be more great, and the symptoms are much worse, and some patients might actually die due to an acute COPD exacerbation if it happened during Hajj or during Umrah or so. So the exacerbation of COPD, acute exacerbation, might be more worse, and you should be able to know how to face such issue and how to make life more smooth in these patients. The visit is always important before the recommendation that a COPD patient should have a visit before he go to like a mass gathering event, whether religious or sport or others, social events. Always there is a strong recommendation that the patient should have regular visit to his physician, because there are what's called our GOLD guidelines, which is the Global Obstructive Lung Disease Guidelines, which are put for such patients. And a good clinician can apply these guidelines and can differentiate between stable or unstable COPD. Because unstable COPD, we tend to advise them not to perform Hajj or Umrah, and I did this. Some patients listen to me and some they don't. But at least the healthcare providers should give the proper advice on the condition of the patient before the event, with good assessment and good guidelines. The vaccination issue is always be there, even with asthma and others, that we have to make sure that the patient had the proper vaccinations that are recommended for such patients, which are annual or biannual now. Even for COPDers, the biannual vaccinations is more recommended, and the patient should keep that in mind. Make sure that he had enough vaccinations before the major events. The severity of the case also can be properly managed by the healthcare provider or the doctor, specialized doctor, and can tell the patient whether his condition is severe or mild, because mild cases tends to have less exacerbations, while the severe cases where they are hypoxemic and they might need oxygen is a problem. And I strongly really advise these patients not to go for Hajj or even Umrah, the severe cases of COPD, because they cannot even walk. If they are under like conditions where there are no wheelchairs and the patient cannot walk due to the severe respiratory failure that the patient is suffering from, then such patient should have the recommendation of not to join such events, especially if he does not have special care with him or somebody who can help him always there. The COPD medication, similar to asthma, that the patient should be aware of them, should know, should have enough stock. And there are some patients, I mentioned already, the high-risk group of COPD should be also labeled. The protective measures is always also advisable. masks and others, and social distancing, and always out the most latest updates on COPD management. Another disease that also existing, and we have patients around working with that disease, is chronic bronchiectasis, where, as you know, chronic destructive lungs, and the patient have chronic cough, and the lungs are not having full function. Disease called bronchiectasis. That disease also tends to have acute superimposed infection, and they are actually likely to get the infection very quickly in these patients. And they go into, because the lungs are not normal, and immunity of the lung, immune system of the lungs is not normal. So these patients, they tend to have more problem if they acquire COVID, for example, or even influenza. So these patients should be also given the warning. They should know, they should visit their physicians to have the proper assessment. And the severe cases who are complicated by cor pulmonale or chronic respiratory failure might have the advice of not to perform Hajj to this degree in case that the expectation is high. As you know, probably, I'm sure you are aware, we lost good number of COVID patients because of pre-existing lung disease. Because one of the problems with COVID is that if the patient has pre-existing destructive lungs, if COVID-19 gets superimposed infection on top, the patient may have go into respiratory failure, may need ICU care, and may need mechanical ventilation. So these patients also, they should be aware of that, and they should be given warning, and they should know what are the problem of that they might face if they perform Hajj or Umrah. And they should be aware of how to take their protective measures and make sure that they don't go into severe deterioration because it is expected in such patient. So bronchiectasis patient, although less common and less more like, alhamdulillah, they are not as common as asthma and COPD, but still we should identify them and give them all the possible help and advices before they go to Hajj or Umrah. The same pre-event medical visits is advisable for them. The maximum medication should be there. There is something called postural drainage that we recommend bronchiectasis patient to perform. So always we tell them that please try this, because postural drainage tends to get the sputum out. And if the sputum existing in the lungs, the chance for infection and superimposed infection and deterioration is more. So we might advise them for proper postural drainage that they should maintain daily with education. And some patients may have, or we may give them protective antibiotics or antivirals even before they go, what we call as the protective it's not prophylaxis, but actually it is something that can help them to reduce the chance of acute exacerbation in such circumstance. The last group that I'm going to speak about are those who are on long-term oxygen therapy. And probably you have seen these patients now. They are, we see them commonly. They are using oxygen all the time. We call them long-term oxygen therapy patients, that the oxygen is there. The patient has chronic respiratory failure, and he is maintained on oxygen therapy everywhere. Even if you go to attend a small social event, he should have his oxygen cylinder with him, because he cannot stay and he cannot stand even few minutes without oxygen. Such patients, again, are high-risk patients. Imagine that such patient is going to Hajj, and he needs oxygen cylinder all the time. Did you allow him to go? It's a big question for such patients. Of course, usually if the patient had performed Hajj before, I tend to ask him not to go. Because alhamdulillah, you made one Hajj, khalas. That's enough for you. You don't need to go and maintain another Hajj because you can run into trouble. And during Hajj, you may not have somebody helping you with another oxygen cylinder or backup oxygen machine and so on. However, some patients, they said, we never had Hajj and we still need to do Hajj, Hajj al-Faridah, for example. Should you allow him to go for Hajj? It's a big question that we face in our clinics. And such patients, you may allow them with special warnings, and they should know how to handle, and they should even, this is my advice, still this point has not been taken in consideration, but I think there should be some special kind of like companies or what I mean, mutawafin, who are ready to deal with such patients. And they identify them and they put them in certain like situation. Of course, they may have to pay more for the service, such patients, or they may have to go through help through the government, which can be provided and rearranged. But such patients should have special planning when they want to attend Umrah and Hajj. They cannot just go and take their cylinder and book the first flight or the first car and they go to Hajj. No, they should have a lot of preparation and they should know how, where they are going to settle and what are the situations around them. And they should have special services during the travel and transportation between al-Masha'ir with their oxygen cylinders. So special care for these patients should be prearranged before you can allow them to travel. And that's why I still always recommend that all people who are trying to perform such religious activities is that they should have a Stibyan questionnaire that they should send to them. Are you on oxygen? Are you diabetic? Are you taking medications? And so with such Stibyan and such questionnaire, you can identify these patients and be ready for them on how to handle them during these social gathering or religious gathering events, and get prepared before that. So these patients, they tend to have more difficult mobilization, more technical problems, and some patients may have problems with the maintenance of their oxygen machines. And he should be make sure, like for example, patient on a machine, an oxygen, and this machine suddenly stops in the middle of the Hajj. It does not work. There is no backup machine. There is no somebody who can maintain the machine because it's a special machine that needs special maintenance. With such things should be pre-arranged with such patient before you allow them to go through this issue. The advised issues about patients on long-term oxygen therapy is here in this list. The pre-event medical assessment, we should ask about technical support, and they should have an assistant and contact person. They should have a backup system of oxygen. They should have action plans which are written so that people can get back to it. And warning signs and education plans. So such patients need special care. And as you know now, for example, Khutut al-Saudiya, Saudi Airlines, or even other airlines, they check if the patient needs oxygen during the flight, and there are certain screening methods that they are requested to go through. And I think we should have similar things for those who are attending the holy mosques and the Hajj and Umrah, if they are patients who are almost like disabled and they need oxygen for the travel. So in conclusion, there should be a complete understanding of the disease that the patient is suffering from, and the healthcare provider should know the guidelines for these patients if he is part of the EMS system of the event. The pre-event medical assessment is mandatory to all patients with pre-existing respiratory disease before they attend, or we allow them to attend such events. All the recommendations should be followed strictly, and we should give warning to everybody about the recommendations. The health education part is very basic, and we should, for the healthcare provider and for the patient, and backup evacuation plans should be part, which I be part of any plans and EMS systems in areas with social gathering or mass gathering events, whether religious, sports, or any kind of mass gathering events, that these plans of EMS system in these areas should be ready of how to face such patients, which I gave you examples only for the respiratory, the asthma, COPD, bronchiectasis, and the long-term oxygen therapy patients, that the EMS system should be ready to face such cases and should know how to handle them, and should be ready even for a quick evacuation plans for such patient if they need. So this is what I can give you about this part, and I'm sure, I don't know, the questions are now or later. I don't see Dr. Muhammad. So the questions now or later? Maybe.
Any questions?
Any questions regarding this, these
Yes.
pre-existing asthma patients?
Yes,
I
we
mean,
do.
respiratory disease. Yes.
We do. One question.
السلام عليكم. أنا دكتورة نادية عويضة consultant family physician طيبة University. أشكرك دكتور بدر على المحاضرة الرائعة. لكن إحنا اللي بنشوفه في during حج إنه معظم asthmatic pilgrims they will exacerbate their asthma, whether they are controlled or partially controlled, they will go to the level up. So can we suggest stepping up their medication before arrival, even if they have good control, especially on the basis that they are, most of them are elderly patients, they exposed to the triggers, and they have no social support. They could not have the medical care at the suitable time. So can we stepping up their medication before arrival, even if they are good control?
Thank you for the question. First of all, as I told you, that the patient should have a pre-event visit. And in the pre-event visit, if he is in good hands, the place would probably, or the physician probably will know whether he will need a step up or he is maintained and controlled. Because some patients, there is a common that we know as respirologists, and even in the statistics, it showed that a lot of asthmatic, they think that they are under control, and they think they are stable because they underestimate their disease. So we cannot leave it to them. They should always see the physician. This is one part. The second part is that if they go to see the physician, they should have proper assessment. Because some patients might appear controlled and they are okay, but if you go through the tests, for example, spirometry, beat flow meters, or the asthma control test, you will find them that they are not controlled or partially controlled. So if you discover that early, of course, you step up the medications and it is recommended. However, if the patient, you are sure according to guidelines and things are okay, there is no recommendation to step up just like that because he is going for Hajj. Because sometimes the stepping up the medications will go to side effects. For example, increasing ICS, the inhaled corticosteroids, is one of the step up. Increasing ICS, inhaled corticosteroids. Increasing ICS without a need might predispose the patient for infection or other side effects. So you have to be careful. We cannot make it a general statement that any patient going to Hajj, just step up your medication up, because we are heading again to another like area which are side effects. So yes and no. Yes, step up if the patient is not well controlled according to guidelines. But if you are sure patient is 100% stable, no recommendation for stepping up.
عندك أسئلة ثانية يا دكتورة؟ طيب عندنا سؤال ثاني لك يا دكتور بدر.
Assalamu alaikum. Particularly for the Hajj, the people are coming from the different countries of the world. So is there any way to collect the data of the COPD patient that is coming from the different country so that the equipment and the facility should be available here accordingly should be managed?
Yes, this is recommended. As I was telling, the high risk patient or the unstable patients or patient or on special demands, they should be labeled. And there has been a question about whether you use the high risk group label for such patient or not. The problem with this is that sometimes it will increase the costs. If somebody is coming up with COPD and he is labeled as high risk or something, he may run into troubles. So this is coming or stepping on the social, on the personal data, whether such patient should disclose all his data before Hajj or not. It may prevent him from performing Hajj. And some patients tend not to disclose such data because he doesn't want to be prevented from attending Hajj. So yes, it will be good to know, be good to manage, but again, you cannot force people that you will not come to Hajj unless you tell us everything about yourself. Sometimes this might not be within the ethical situation. So you have again to run in the middle, and if the patient tells you, that's fine. If not, then don't label him, because again, labeling individuals might not be totally ethical.
Any questions? Thank you, Dr. Badur.
Thank you.
Thank you so much. The second lecture is Dr. Mazen Al-Shamrani. Ready? جاهزين؟
في slides again.
Second lecture, the second one lectures will be about the virtual clinic intensive implementing and evaluation during Hajj.
طيب بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. Good morning everyone and welcome to this second day sessions, and I'm gonna speak about inshallah about the virtual clinics initiative at Hajj, the implementation and evaluation has been implemented in Hajj of the 2023, the year before of Hajj. This initiative been driven from the importance of providing services or healthcare services in Hajj and Umrah. Indeed, there is a lot of efforts being provided, especially in each year of Hajj. We see a lot of initiatives, a lot of tools used and employed for Hajj people. And the target is to have well-being services with high quality and using the wide range of technologies that we have and how to use these technologies in an efficient way and provide high quality of services, especially in the healthcare system. The importance of virtual clinics initiative is being driven from the observation during Hajj for long years and for long time that we recognize there is a high demand of healthcare services, and we classify these services on urgent, non-urgent, and of course, in this initiative, we focus on non-urgent consultations that we need for a mass number of Hajj during the Hajj days. This will, of course, decreasing the number of non-emergency patients in the hospitals and the healthcare facilities in Mecca, Medina, in the holy sites. Of course, employing technologies will raise the awareness of how to deploy and use the available resources in Hajj, especially resources which are out, not in Mecca, in Medina, and we have different healthcare resources that are available, but how to bring these resources to Hajj in such an efficient way. We built this initiative with a group of specialized people in Hajj in healthcare by providing remote healthcare services to deliver services without the needing of the patient be in person in this in his location, or the doctor need to be in person in the location of the patient, and also for this facilitating the access to healthcare services. As we know, we have now technology. Everyone has his own mobile devices, has their own connectivity with the internet. However, healthcare services also are available in such a way to provide remote services through the internet systems. Also, in saving time and cost with going to clinics whenever you go to clinics, you spend time. At Hajj, the traffics are difficult. The mobility is exhausted with the high mass of people. We aim to save time, save opportunities, or to provide opportunities to be served in your location, in your house, in your tent at Arafah or at Mina. These are also objectives of this initiative. So the implementation was been driven in such steps first, we gain the support and the legal approvals by the related parties. Ministry of Health was a great partner in this initiative. So we gained the related approvals. We gained the Ministry of Health support, and then we used to implement the system platform. And this is the critical part of the initiative, how to implement the technology-based solution that will go to run at Hajj. So we developed app with connectivity and admin-based platform. Then, of course, in parallel, we manage the doctors' availability and their engagement in our initiative based on their specialization to be with us in remotely basis attendance. Then we trained the doctors and the health representatives about how to use this app and the system. So we made training sessions specialized for them to make sure that during the season of Hajj, or the implementation of this initiative, all things being sorted well. And we partnered with different beneficiary parties, like some of the Hajj companies. So to be with us in the implementation of this initiative. And then we provide also an online clinic, technical support for this implementation of this initiative. Our partners, first, we have different parties involved in this initiative. From Al-Quran University, we have a supportive team and a specialized team in this initiative. And also from Ministry of Health, we have a good team from them, and University of Abdulmalik Abdulaziz, King Abdulaziz University, and a number of beneficiary parties from the Hajj companies. Also, some third parties partners in this initiative. So we covered this the most important parties for to employ this initiative in a good manner and to succeed in different access in this in the Hajj. طيب. The system design of the platform was focusing on improving a virtual clinic platform. So we used Istinara Manasik platform, which is an already built-in platform, which has its own license and approval by the Ministry of Health. So we don't waste time to get these approvals and use the available resources. And we built this platform as a mobile applications that can be used by the patients themselves and by the doctors, and also by admins who can access and see this system. So in the left hand, we have the Hajj Pilgrim application, and then connected with a virtual clinic platform of Istinara Manasik. And in the right-hand side, we can see the doctor's system. So we have apps and PCs, so doctor can connect it through this platform easily. And also we have our control and quality management observers as an admin. And also these data are stored and can be fixed and applied to to have models by the artificial intelligence tools and deep learning systems. So in the overall system has a human factor and a technology factor and a quality observation factors are all being engaged in this system. Istinara Manasik was a challenging point to until it's seen the light. Istinara Manasik, as we have two versions, we have for Apple Store's version and for also Google Android system to fulfill with all the needs of using and employing these applications in the beneficiaries' devices. In this system, of course, being approved by also Ministry, University, or King Abdulaziz University as a technical approval to guarantee that this system can be used and implemented well during the Hajj. The initiative implementation has or had three models during Hajj. The first model was to use apps from the doctor sides. So we have doctors from Riyadh, from Al Khobar, from Jeddah, who were not inside in Mecca or Medina. They've been involved and get the honor of participate in Hajj consultation services for pilgrims through the platform. And the first model was the doctors themselves attending by themselves through the platform. This can be a direct connectivity between the patient and the doctors. This model designed for camps and pilgrims at their accommodations at Mecca. And we focus on Arab countries and some of the European and African countries who speak English in this stage. The second model is focusing of providing these services through volunteer teams and through healthcare representatives and translators who were as a component with the Hajj. So anyone who can't use it, he can use this application through these healthcare or healthcare givers who can handle the application and connect with the system through the system with the doctors. So the volunteers downloaded the application directly on their smartphones, and we have to facilitate the communication through these applications with the Arab countries as a target audience. Also, we had about 15 translators who provided different languages like Urdu, Turkish, Indonesian, Russian, and Hausa. All these translators work with us as in location representative for this system to be connected with the doctors. The third model was through official clinics with Hajj Affairs offices. We used to have implementation with the Moroccan Hajj Affairs office, who downloaded the system, applied in their end, and connected through this system with the doctors. We had about 110 members of the Moroccan Hajj mission in the center, who, including the patients and the officials, people who download this system and applied the communication with their pilgrims. So at the end, we have a temporal and spatial boundaries at this initiative. So in time, the time zone of this initiative was the days of Hajj from 8th to 13th of Dhul Hijjah, about 6 days or 7 days before that. We began as training. We spent about 2 weeks training for the representative and the doctors. Also, we applied it in the accommodation at Mecca. So in Mecca and in Arafah and in Mina, we applied our team there for this initiative. And we used some available resources like Ministry of Health volunteering hours for doctors who want to be part of this initiative to provide 24/7 services during Hajj days. The doctors who participated with us, 40% of them were specialized consultants, and 35% are specialists. In the participation, we had about 42 doctors who applied, or actually more than that. We reached about 70 doctors who applied at the end of the initiative. But officially, they registered for about 42 doctors from around the kingdom. And the total participated, we got about 20 doctors for this initiative implementation. As you see, we have the most of doctors who came to this initiative came from Riyadh, of course, remotely connected from Riyadh, Jeddah, and we have a number of those doctors from Mecca and Medina as well. So we can say most of the regions of the kingdom participated in this initiative as a 24/7 attendance in the platform. We have number of consultation provided at the total of we have about 1,006 more than 1,000 official medical consultations. Mina was the most demand area of these consultations. More about than we can say 45% of these consultations at Mina days. We also have at Arafah, we had a good number of consultations at Arafah. And most of these consultations are general consultations. We had a number of consultations where we end up with providing a recommendation that they need to go to the hospital as an urgent way. But most of them are general consultations. The doctors give prescriptions for these patients and end up with just taking medical medicines during their Hajj. In Mecca, also in the Mecca accommodation, we had a number of consultations. Muzdalifah was the shortest demand of this consultation, as the Muzdalifah were a very short time during this initiative. طيب, we measure then the level of acceptance of this initiative and the people who participated with us. We asked the volunteer doctors about this initiative. As you know, the challenge was we have virtual clinics. Doctors from outside Mecca are participating in consultation at Mecca. Those doctors face different type of challenges. At the end, most of the doctors, they see it was highly important initiative, and they really love the experience. And we applied it only on 2023 Hajj, and we received a request by a huge number of doctors to be applied by 2024, but because of some of the administrative issues, we didn't apply it in the last Hajj. However, the results of this initiative were very applicable to be implemented in different Hajj, inshallah, for next years. In the doctor side, we received a very high acceptance and likely to be with us in other years. Also, the doctors who participated in this initiative mentioned that they had serving pilgrims through specialized medical consultations and providing consultation for a large number of pilgrims, and they feel honored about this participation. And of course, they cared about how to guarantee that this the patient get the right service. We had some cases that when connectivity been lost between both the doctors and the patient, the doctors called the patient side by telephone. So the internet connectivity sometimes is a challenge, but we used to use sometimes the calling system. But at the end, the platform is the way of reporting the cases, and also to provide the prescriptions for the patients through the platform. The most important challenges we faced is, of course, the technology-based problem is the connectivity. We had a problem with the connectivity at the during the Hajj, because of the high demand of the network system, the services. There is sometimes a connectivity problem. Also, limitations of the doctor's skills with technology. We try to recover that before the Hajj by training, but during the season, we can't guarantee the capabilities and the skills of the doctors. We, of course, used the support, technical support services to help them to be back to the network or to solve some technical issues. And also, some of doctors raise that some of the difficulties of using the applications, because the applications sometimes need to be improved by different versions. So we have our first versions of Istidara Manasik, but alhamdulillah, it was acceptable by both sides, the patient side and the doctor sides. Also, we have limited training for newcomers of the like the people who volunteered in the locations. They had some limitations in training. We tried to recover it during the season. Also, the health workers who participated with us shown a good level and high level of specification about this journey with us in this initiative. There are translators as well, as translators used to be good interface between the patients and the doctors. They had a really good involvement in this initiative. That's why we enlarged the portions of involvement by such translators, and also shown good level of acceptance in this initiative. And then the recommendations, we really studied this initiative from technical side, from beneficiary side, and we wrote a number of reports about this initiative and raised it to the related partners about how this initiative went through during that Hajj. And we really recommend that the expanding of this virtual clinic initiative to be included in Hajj accommodation buildings as a fixed service. So no accommodation in Mecca existing without a virtual clinic, for example, because virtual clinics will save time, costs, also in the reachability to Hajj. And as you know, most of the cases are cold cases, came to hospital, and they return back to the hospital, to their accommodation with يعني normal prescriptions in medicine. But why not we do this at their accommodation? So we save time, we save a huge amount of traffic of those people who come go back to the hospitals by such an يعني a virtual clinic initiative. Hajj affairs also, medical clinics can be using this system, and also Hajj clinics in the holy sites. Of course, there is remote clinics provided by the Ministry of Health, but Hajj is still not activated, and this initiative was the first activation of such a solution during Hajj days. Also, we have some notes about the interface and about the application, how to improve it, how to use the user-friendly interface for both sides. Our system were used only two language, Arabic and English. We're gonna, inshallah, we aiming next year, inshallah, implemented in about 7 languages. So the interface will be easily for the users, and also to write the prescriptions and generate the performance indicators of this system, and prepare statistical reports about the medical cases. Also developing the application to enhance the integration and the operation between the Ministry of Health, the Ministry of Hajj as well. All of us know that all the visitors or all the pilgrims will come. They have their own medical record at Nusuk application. So Nusuk is a good platform to be connected in such a solution. And all pharmaceutical and laboratories and radiologies will go through such a platform in a technology-based system. Also, we aiming to develop a more enhanced artificial intelligence system in the translating of the languages and facilitating the communication with the doctors and reporting and prediction models for the patients based on their records and their data that been collected in the site. We hope this initiative will be a continuous research program, inshallah, in the next coming years. And hopefully, inshallah, we see this initiative and this service provided in a larger scale of Hajj and Mu'tamirs during their visit to Saudi Arabia, inshallah. Thank you for listening. And if you have any questions about the initiative.
Any questions? تفضل.
Yeah, the AI. Thank you really for this very good experience that you shared with us. And I'm sure that the future will be promising. My thinking was, as you know, that we are always in short of manpower, and it not be and the 24/7 is not easy during Hajj, and like Eid and others are not. So what I was thinking, I was also sharing with my colleague here, is why we don't go for, or did you hear about the AI-based remote clinics, screening clinics, where the individual during Hajj can have these small boxes, he can enter in it, and he just go there. He can check his blood pressure, that box can check his temperature, he can communicate. It's an AI based without somebody there. And it will give him whether you need to go to see somebody, or most of the cases which we have seen in our experience, that you are stable, don't worry, go back home.
Yes.
So did you think about AI-based remote clinics without manpower, no doctors? At most, you can train somebody who's a lay person to be there within the box there to connect the patient to certain things, and then the patient deal with himself. no doctor, and it has been discovered that AI can be even better than physicians. He can ask him, do you have shortness of breath? With different languages. Do you have chest pain? He say, no, 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 yes, 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 yes. And then an end report telling him this will be very useful in the Hajj area where the small boxes are there, high tech, and it can be retrieved. Yani you are not losing these people. Nobody will destroy them, I hope. And it will be good experience for reassuring or go to the hospitals. What do you think about this?
MashaAllah, you are a good visionary, Doctor. Jazakallah khair, Doctor. Yes, it's available, but I think in Hajj we still need, through research, to approve such solutions. Hajj, most of Hajj, about 65% of people who come to Hajj are elderly people. I mean, 60 years or 65 years and older. So during this initiative, we faced problem how to deal with elderly people. That's why we need healthcare or caregiver or people who attend with those people in the location, because they don't even use the application. I think the way we deal with this initiative, we thought about AI. Of course, AI is available and a lot of tools are there, but we had some challenges about how to approve this way of solutions, because of Ministry of Health don't allow anyone to work without approval stages. Self-attendance clinics is a really futuristic initiative. Inshallah, we'll try to use it. It's on our mind, but not in maybe in Hajj, maybe in Umrah, to have a self-attendance clinics at hotels, for example, or at certain points in Mecca and like Haram and other sites. However, we try to have the human factor in our initiative as much as we can, because at the end, the AI is trained. We trained AI to be like human. So we're still in the training stages. Inshallah, we try to apply this initiative through the Hajj Institute in our next coming or opportunities, inshallah. Shukran.
Any questions?
Assalamu alaikum. Thank you for this informative talk. I want to ask about how did you address the documentation issue in these consultations, the virtual consultations, and the medical legal aspect of it, and how the patient will be followed up afterwards?
It's a very early stage of the initiative, and we use document for each patient. We have a file, and we document the file, the patient information, records and readings, and as a normal electronic file for the patient. The documentation been written in a normal base, and the follow-up if needed. Mashallah, doctors were more than they had good concerns about the patients, and they used to follow up some cases. We have about like in 13 cases being followed up after Hajj even by the same doctor. He volunteered also in connecting with the patient to guarantee this patient being given the right level of services. But at the end, all these are accumulative way of learning how to serve Hajj. Each year by year, I think this file of how to serve Hajj through electronic system will be provided very well enhanced through the Hajj seasons. Any other questions?
أي سؤال ثاني؟
طيب شكرا جزيلا.
مع المحاضرة الثالثة مع الدكتور مؤيد البدراني. عنوان المحاضرة Large Scale Health Intervention Registration.
Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm gonna introducing about the large scale health intervention registration. So I'm gonna introduce the topic. I should ask myself what is the large scale interventions that sometimes needed in mass gathering to have the large scale intervention, because the mass gathering and emergency context, they have many challenges that need large scale intervention, and that I'm gonna explaining. Some of them are medical and some of them are non-medical. The objective of this lecture is the importance of the large scale intervention registration for public health safety and effectiveness, and enhancing the health outcome through the better intervention, coordination, and monitoring. So large-scale intervention are organized effort aimed to protecting the health of large population, even in events like the mass gathering or emergency situation. So the significance of the large-scale intervention to prevent diseases, making the multi-sector health system coordination, also public safety and resource optimization, and as a requirement of IHR, that the global health impact for the large scale intervention is on demand sometime from even WHO. When we look to the objectives for registration of the large intervention, improving monitoring and tracking, data collection, analysis, enhancing coordination between the different sector and the different stakeholders, because when we talking about the stakeholders, we have non-medical stakeholders sometimes is involving also the registration help accountability. So we see where is the shortcoming if we look to the large scale intervention, and facilitating also the emergency response when we have a robust surveillance system. Surveillance system can be considered a part of part of the large scale intervention. So when we look at the large scale intervention, sometimes it may be medical interventions such as a vaccination campaign or medical screening, and sometimes also the non-medical like crowd control. I'm gonna give in the next lecture about the resiliency about the crowd control how can be contributing for the safety of the attendee to the mass gatherings. The scope of registration could be documentation, the mainly concern about documentation of each steps, and there are necessary steps that needed for registration for the interventions, and what are the sequelae of them, and the data collection, and even the privacy, ensuring the privacy for data collection. When we look to the health risk in mass gathering, there are different risks be classified from infectious, non-infectious like non-communicable disease, accident, injuries, and these can be applied to different examples of the mass gathering, such as Hajj, even the sports events, and that also can helping in managing the health challenges through registers intervention. So the rule of registration, sometimes it's initiated by the regulatory framework, even the international health regulation. It's required, is mandating for documenting each steps for the large scale intervention, and you have also monitoring, data monitoring and evaluation for this intervention. And also, as I said before, there are different sectors, even non-medical can be involved. So we need to have their contribution to be known, even the NGOs or international organization, if they interfering in the registration. So the steps of registration is pre-planning. We should have the pre-planning and assessment and risk evaluation. Then we have registration protocols, having the variables that needed, criteria and submission process. All of this should be involved. Then the data collection process, which is the reporting after the data collection, to make sure that we have the accurate information for the intervention manager. Can use the technologies nowadays. There are different digital solutions like apps and software can be utilized that can, and we have different successful example for technology use in the mass gatherings by using the application for the surveillance system has been seen in different situations of the mass gathering. When we looked at the challenges and barriers for the documentation, sometimes they having the logistical challenges, so they not have the equipment for registering or for registration, and even sometimes there are some sort of cultural sensitivity toward for the stakeholders, and it depends on the norms in each community. So some communities not allowing taking the data in a proper manner, and even there are ethical challenges like privacy, data security, and informed consent. So the best practices is the coordination among the different stakeholders, and also by building and enhancing the capacity for the documentation. This is another way, and also we need to have the post-event evaluation, analyzing the data in order to know where is the shortcoming. So in conclusion, proper registration of the large scale health intervention can helping for assessing the effectiveness of large scale intervention, and also ensuring the safety. It can help also better coordination among different stakeholders, and implementing a strong system for intervention registration and monitoring is necessitated by international health regulation. Thank you. Question? Next speaker is Dr.
No questions? MashaAllah. It sounds like you are very awake and very attentive to the lectures. Huh? طيب. I think we should continue so we can finish today early. Is it okay with you? دوبنا خلصنا الفطور, it's better to continue. Okay. Thank you, Dr. Badrani. Our next speaker, Dr. Ahmed Al-Afghani, he will talk about the impact of infectious disease in mass gathering. our break will be at 1 o'clock, okay? For lunch and for prayer, inshallah. دكتور
Slides ready ولا؟
سلايدز يا شباب. طبعا till دكتور أحمد started his presentation. طبعا ما شاء الله معظم الحضور اونلاين. انا ملاحظ انه الفيزيكال اتندنس الظاهر الناس صارت most of the attendees now they prefer to be online. ف احنا ودنا نشجعهم انهم يجوا physically افضل يعني عشان الدسكشن if there is any question from the online group they can send it to us. Also if there is any comments or any suggestion for this conference please. يعني we have colleagues from Malaysia, they were يعني talking to us and they wish to be part of the conference next year. يعني برضو ماليزيا ما شاء الله they are taking very important role in mass gathering medicine. if there is any suggestion or any comments or any advice, please we are more than happy to receive your comments.
السلام عليكم ورحمة الله وبركاته. We proceed with our second lecture, which is the impact of infectious diseases in mass gathering. Infectious diseases as disease spectrum and specialty are important in many aspects of life, playing a major role in prevention and managing problems in mass gathering events, ensuring that correct standards are applied to risk assessment, surveillance, and response, including outbreaks, management, infection control, and vaccination. Supporting planning for the management of mass casualties and emergencies in local communities at event venues, adequate diagnostic capacities, including human resources and transport procedures, are in place. Now, going back to review the impact of COVID-19 on mass gathering here in KSA during 2020, Hajj and Umrah seasons were affected the most. Mitigation plans taken place by the Saudi government after recognizing the potential risk associated with this event since the first COVID case announced in March 2020. The return of possibly infected pilgrims to their countries after this huge mass gathering could have turned the Hajj into a super spreading event during the global COVID-19 pandemic. WHO encouraged all countries to apply risk-based approaches to properly decide the best scenario for any mass gathering, whether the event to be restricted or modified or postponed, cancelled, or held as planned. The Saudi government high level of awareness and readiness resulted from lessons learned during the previous pandemics, such as H1N1 pandemic in 2009. In 2020, a total of 1,000 pilgrims from 160 different countries were randomly selected to perform the rituals in Hajj holy season. Of all pilgrims, healthcare personnel and non-medical employees facilitating the rituals, none were having COVID-19 during the Hajj or after. Reducing the number of pilgrims was a courageous and well-calculated decisions based on risk assessment and wide consultation with relevant stakeholders, including religious leaders. Although these measures helped in conducting successful holy rituals, posed its casualties on country pilgrimage plans for many people wishes for doing the holy rituals at that year. And this dilemma was not limited to our country. Many prominent mass gatherings have been cancelled or postponed, including sport fixtures such as Euro 2020 Football Championship and the Formula One Grand Prix in China, etc. However, the scale of the problem have declined over the years as better public health measures have been implemented at mass gatherings in response to the WHO Assembly endorsement in 2011. Again, to understand the impact of infectious disease, we have to go to the history. Many events were held during the outbreaks and pandemics. For example, the Vancouver 2010 Winter Olympics and the 2010 FIFA World Cup in South Africa during H1N1 pandemic, and the 2015 African Cup of Nations football tournament in Equatorial Guinea during the outbreak of Ebola virus, and the Rio 2016 Olympics during Zika virus outbreak. The Kumbh Mela Hindu religious pilgrimage festival, and despite the Indian government of doing preventive measures for outbreaks to prevent contamination of the Ganga River, which is the main event, was inevitable and leads to the transmission of waterborne infections such as cholera outbreak or pandemic and MDR bacterial transmission. The 2018 FIFA World Cup was hosted by Russia between 14 July and 15 July 2018. The event was attended by 3 million people across 11 cities. Although no reported major public health concerns, however, the 2018 FIFA World Cup created heightened awareness of threat of transmission and globalization of antimicrobial resistant bacteria. Now, the current infectious diseases risk, which is Mpox and formerly known as monkeypox, is an emerging zoonotic disease caused by the Mpox virus, which affect both human and animals. In 2022, a global outbreak of Mpox occurred in various countries across Europe and America, and rapidly spread to more than 100 countries and regions. The WHO declared the outbreak to be a public health emergency of international concern due to the rapid spread of the Mpox virus strain. Consequently, nations intensified their efforts to explore treatment strategies at combating the infection and its dissemination. Now let's have a back history of the nature of the disease. First, the virus was discovered in 1958, isolated from monkeys in Denmark. Then 1970, the first confirmed human case in Congo. In 1980, sporadic cases of Mpox kept to be reported in Congo. However, some of them was missed as chickenpox diagnosis. In 1981 to 1986, WHO raised the project to monitor the plan for human Mpox in Congo. In 1996 to 97, an outbreak of Mpox, over 500 patients infected in Congo. In 2003, Mpox was first detected in non-endemic areas and sporadic cases in United States. In 2017, a massive outbreak with more than 100 confirmed cases in Nigeria. 2018 and to 2019, sporadic cases again reported in UK and Israel and Singapore. In 2022, WHO announced Mpox as public health emergency of international concern. More than 60,000 cases have been reported in 105 countries, with more than 3,000 cases in UK. WHO announced Mpox to be monkeypox to be renamed to Mpox to avoid racial discrimination and disease stigma. In 2023, the WHO announced Mpox as no longer constitute a public health emergency of international concern. Nevertheless, the available therapeutic options for Mpox remain limited. So up till now, there is no robust antiviral treatment. Although the WHO declared that Mpox no longer public health emergency of international concern in May 2023, it is important to highlight that the certain regions in Asia have experienced a rise in Mpox cases due to the virus rapid evolution and mutation, with increased international travels. In this current epidemic, most Mpox cases are not associated with contact with infected animals or travel, but with sexual activity between individuals. The incubation period of Mpox is approximately 7 to 14 days, with symptoms lasting from 2 weeks to 3 weeks. The prolonged incubation period poses a significant challenge for accurate diagnosis, potentially leading to delayed medical attention, disease progression, and further transmission of the virus. This picture showing a certain Mpox rash, which is a pustular rash. So in conclusion, infectious diseases are hazardous factor for mass gathering and in affecting public health and economy of hosting and attending parties. Recognizing and implementing tools for infectious diseases are utmost need to control outbreaks, epidemic, and pandemics. And it might be challenging given the virus mutation and bacterial resistance. However, it's still worthy to invest time, money, and efforts to reach a safe zone in conducting mass gatherings.
Thank you very much, Dr. Ahmed, for this interesting talk. Our next speaker is Professor Badr Al-Ghamdi. We'll go back again to respiratory disease. We'll make the question after Dr. Al-Ghamdi, okay? Better. طيب. Professor Al-Ghamdi will talk about respiratory disease problem in the two holy mosques.
Thank you, Dr. Muhammad. Maybe we will not call it respiratory disease problems, respiratory medical considerations in the two holy mosques that are should be looked at. So this is my third presentation today about respiratory medicine in mass gathering situations. And I think, as I was telling, that respiratory diseases or the respiratory part is one of the important elements in mass gathering medicine. And it is always recommended that all healthcare providers in mass gathering medicine actually have enough data and training about the respiratory part of it. So just as you know, that the two holy mosques in our country, alhamdulillah, are actually having daily kind of mass gathering events that thousands of people are gathering in these mosques for prayer and for other religious activities. And it is well known that these mosques face Hajj, Umrah, Ramadan season, almost 30 days, 1 month, ziyarah all over the year, and the daily 5 times prayer. So it is important really to consider this part. And as you know, also the KSA vision of our Prince Mohammed bin Salman, the Crown Prince, vision is well maintained that the country is attracting more and more people in getting into the religious and other activities in the country. So it is very important to look at the 2 holy mosques from this aspects to improve all the healthcare systems around them. The current medical efforts that everybody see that our country actually is maintaining excellent preventive, protective, and therapeutic medical care measures around the mosques. And I was really happy seeing the AED, as you know, AED, the automated automated defibrillators are now available there inside the mosques where you can use them for BLS and for the cardiac arrest cases. And we see every day excellent improvement in these 2 holy mosques. So the cardiac part really is good there. And I thought also we need to look at the respiratory medical considerations in the 2 holy mosques as a respirologist. And as you know, I'm always, whenever I visit these mosques, I look at what can we do more to be at the front and to improve the care in the Masjid al-Nabawi and Masjid al-Haram. That as we all look at being always at the front as a Kingdom of Saudi Arabia. The special focus on these 2 holy mosques is obvious, as I told you, because we always look at the thousands of guests that they come every day there, and we want to maintain the best for our these worshippers who are coming for the sake of Allah subhanahu wa ta'ala. The issues that I listed here are the certain things that we should look at in improving the healthcare system in such circumstance. The first part is the respiratory infections. There are certain environmental considerations that we should keep in mind whenever we look at the respiratory issues in the 2 holy mosques. The kind of availability of respiratory care and respiratory systems in these 2 holy mosques is very important, and we should know what are the most important kind of respiratory care that we should keep in mind and keep it around the mosques. The air filtration systems and the ventilation systems in the 2 holy mosques are actually very important. And I am sure from my readings that a lot of efforts were put in the 2 holy mosques to maintain the best ventilation system and the best air filtration systems in these 2 holy mosques. And it is really excellent. I will speak about this more when we come to that part. The cleaning protocols and the surface hygiene that are applied in the mosques, as you know, we all know that, mashallah, the best protocols are applied in these 2 holy mosques, and the best surface hygiene are being implemented. And we need just to look at that from the medical side, especially in the respiratory side. So if we start with the airborne infections and things that you are worried about, and 2 holy mosques are the influenza, COVID-19, MERS, and other influenza-like illnesses. I'm sure my colleagues in ID are aware more about these issues in such mass gathering events, and what are the things that we should look at to improve the healthcare system there. And unfortunately, I face this really commonly, but we don't have good studies that some patients, when they come back from Umrah, for example, they come back having these viral illnesses, picking up them from around. What can we do to improve such circumstance and to put better awareness to these people who are attending Umrah to be more careful so that they don't run into troubles is an issue that should be very important as healthcare provider, ready to tell our customers, I can call them customers rather than patients, so that when they come to us, we tell them really how to be careful and how we give high kind of awareness to the attendee of the two holy mosques, so that they come in and out without being exposed to these viruses. It's difficult, but it can be done. And this is important. We should always keep it in mind. I mean, the important issue is keep it in mind to our customers, to our community of applying these precautions, which I will speak about. Again, I'm coming back to bacterial infections, bacterial pneumonias. Patients, some patients, they come back with bacterial pneumonia rather than viral pneumonias. And I think main part in the bacterial pneumonia is the stress kind of, the lack of rest, the more efforts they apply, and the stress makes the immunity more or less. And we should know how to convey to our individuals there that they should have less exhaustion and they should take good diet, good vitamins, so their immune system is good and well protected. Tuberculosis again is there, and we should look at it for really carefully in all mass gathering events, especially as I told you that we are facing people coming from areas where TB is a problem. And they come there and they come for Umrah and they might actually infect others. So how we can reduce that to the best is an issue that we should look at as healthcare providers and how we can do the studies to improve this. If we start with the preventive strategies that we all know and we should always stress are the hand hygiene and the face mask and the social distancing. My colleague, ID consultant, really stressed on these points. I cannot add more. And he told us what are the way of getting these infections through like handling certain areas there or certain vehicles that we should be aware. So we need really to get this kind of information ready to our to the attendee of the two holy mosques so that they know how to protect themselves from such huge mass gathering areas. And I was really in a place trying to tell them that the hand touching of certain areas is important. Most of the people, they thought that infection comes only from airborne only. So really it is important to endorse the awareness to our like community individuals so that and the attendee of the prayers and the tawaf and sa'i and ziyarah so that they are careful and they know how to go through without getting up the infections. The vaccination part is always there. Our country is stressing on it. The vaccinations are available free However, still a lot of people are not taking them. There is always a stigma now about vaccinations, and they think vaccination is going to put you more sick. Even my kids, by the way, I was trying to give them the vaccination. My son and daughters, and they were refusing to have the vaccinations of annual influenza vaccine and so on. So there is misconduction, and there are a lot of things are running in the media about vaccinations which are not true. Myself, I take the vaccination annually of influenza, as I'm meeting a lot of respiratory cases. And now even the advice is biannual, every 6 months, because of the new strains in influenza that they are advising. And these vaccinations are very important. And I remember when we went the other day, the whole family had the influenza except me. And I'm not just saying this just to be proud, but to tell you how important to take the vaccination. Like as I told you, my family refused to take the influenza vaccine, and I took it. We went to Mecca, and everybody was sick, and I was not. I don't know whether I was applying more protective measures or because I took the vaccine. But anyhow, what I mean is that awareness and education to the attendee of the two holy mosques is very important, and it can help a lot to reduce acquiring the infection around all areas, not only the two holy mosques, but as I am like mentioning these two areas, I think we have to stress the awareness and the education to our people there. The public health education, all measures are important, including the diet and what to eat, and education campaigns, I think should be always around the two holy mosques there. I suggest actually putting areas there of campaigns, even for those who are coming from outside, giving them and this is being done, but I think we need more scale, telling them how to handle things around and how they should be careful about. And these are everywhere, not only so that we label our holy mosques as they are the source. Everywhere where you have mass gathering events, you should be careful and you should have your mask, you should have the social distancing, and you should be careful always about yourself. Of course, I'm always focusing on respiratory disease prevention, but you should be also be careful with other issues like diet and food and so on, which are not only respiratory. The preventive strategies for TB, I think TB still, I'm always, because again, I'm a chest physician, TB is an issue, so I'm always stressing on it. And alhamdulillah, we had some studies, but I think we need more and more from my colleagues in ID to study this issue and to see how many people or how the spread of TB and so on, and how much is the issue of the problem. We need more ultraviolet light, which are done, and you see this, a lot of ultraviolet lights there. It is a weak issue, but still, it is one of the things that has been mentioned, that ultraviolet can deactivate the mycobacterium organisms if it is nearby. So it can help to reduce the infectivity of the sputum and so on. The negative pressures also mentioned by colleagues, by my colleague in ID, and the filters that can be thought about, and other measures which are very important. Another point is the availability of respiratory healthcare needs that should be around the mosque, and this is well done, and I was happy really to see a lot of EMS personnel who are around the mosques are very well trained in applying the respiratory care machines, nebulizers, oxygen. They know how to handle all of these. And we need to provide more training A lot of training has been put on cardiac assessment and cardiac light resuscitation. And I think we need to put more on respiratory resuscitation and respiratory medications, respiratory equipments, and make them more readily available in the areas around the mosques, because the respiratory side is very important in these circumstances. The transportation methods, I don't have to speak more about that. We have that well provided now. There are other environmental considerations that should be put in mind around the two holy mosques. One of them, which I'm very happy with the success that we had, is that we have all the areas around the two holy mosques are non-smoking areas. And this is actually one of the good success story that we can tell, that you don't see anybody smoking around the two holy mosques. And this is really excellent success. And we should push more and more to maintain non-smoking environment in the mosques and around the mosques. And now even violations are being put for those who are not following the rules and regulations of non-smoking areas around the mosques. And even you don't see smoking or cigarettes being sold there around the two holy mosques. Alhamdulillah, this is good success. And I think we should maintain it and even extend the area around that, also during Hajj and other religious activities where we see a lot of people are gathering and so on. The irritants in the two holy mosques are a problem, and some of my patients are actually questioning this, and we should be careful about it. As you see, we see sometimes construction efforts and materials. There is always, and our government is really pushing to finish all the like extensions and areas around the two holy mosques. And we see constructions going on around the clock, 24/7. And sometimes these construction areas, they actually have some irritants going out to those who are attending. And this sometimes can be triggers for asthmatics or patients with the COPD or other respiratory diseases that can make their disease more sick. So we should be careful. I think our good efforts now, I see, are going through this. And you see the construction areas around them now are closed. They don't allow people to go there. But sometimes with emergency or extraordinary maintenance, you can still see constructions around the attendee of the mosques. The cleaning materials also can be irritants. Bakhur and perfumes. This is one of the common like things that been done in the mosques, that they do bakhur, ouda, around the tawaf and around the areas of the haram and so on. It is good to have the nice smell in these areas, but I think we should be careful on what material we are using, and we should be careful of these smokes of the incense that might be triggers for people who are having asthma or other diseases that can make life difficult for them if they are exposed to bakhur and incense around these areas. I think we have good efforts of the analysis of airborne particles in the two holy mosques, and people are studying, and we need more surveillance and more efforts in this regard, because to keep the environment clean will make life easy for the individuals who they have the pre-existing lung diseases. Another important point here is the ventilation system and the air filtration in the two holy mosques. And as I told you, alhamdulillah, a lot of efforts have been made to make the best filtration system and ventilation system in the areas of there. The AC, I read about AC in Mecca. I don't know details about Masjid al-Nabawi, but it has, the standards are very high. And the ventilation methods are great, but more surveillance are needed and more data are important to be done. The cleaning protocols are excellent. I was putting an eye on this and I was looking on the strategies that they are doing, excellent cleaning protocols and surface hygiene. And we have seen the COVID-19 experience where the best was made for around these areas. And always we are looking for future improvement as expected. So I think these are the things that I wanted just to conclude and about the respiratory issues that we should consider around the two holy mosques, which are very important, and I'm sure people are looking at it, that will improve the status as we are all looking for the best. More research is needed about respiratory health and more cooperation with academic institutions and health organizations to make the best use of the technology and air quality monitoring around the two holy mosques. So it is very important to have continuous efforts to improve the respiratory health in the two holy mosques. And we are always looking at, as I told you, Kingdom of Saudi Arabia always wants the front. And we are at the front, and we will maintain the front, inshallah, always. And more case studies and research are needed in this regard, which we are going through. We are looking for more speedy kind of courses, and inshallah, this is, we see it every day. So these are the things I wanted to share with you. Thank you. And if you have, I don't know, the questions now or later,
Thank
Dr.
you.
Muhammad.
Thank you, Professor Badr, for this interesting presentation. We'll leave the question after the next lecture, which will be presented by Dr. Muayyad Al-Badrani. After Dr. Muayyad Al-Badrani, I think we will take a break for prayer and for lunch. It will be at 12:30 inshallah. احنا بكرناها نصف ساعة. Okay? And also after Dr. Badrani lecture will presentation, if there is any questions, just prepare the questions, please. Dr. Al-Badrani will talk about resilience framework for disaster management in mass gathering. تفضل دكتور.
الله وبركاته. I'm presenting today about resiliency framework for disaster management in mass gathering. So I'm going to introduce my topic about the definition of resiliency gathering. So resiliency meaning making our system adaptable to changes, even in preparedness system, response, recovery, and adapting to different scenarios of emergencies. And the importance of the resiliency or importance of enhancing the resiliency in mass gathering, and we need the resiliency to be adaptable or our system for the ability to be adaptable for preparedness or response or recovery. This is in order that usually the mass gathering have high density population and usually in confined spaces. These challenges require to have the strong resilience system. Also, the mass gathering system facing many vulnerabilities depends on the location. For example, maybe some areas are vulnerable to natural disasters, or some having the health risk, the crowding and spreading the infectious disease, and even sometimes infrastructures. We will present some examples regarding even the infrastructure failures. So the key component of the resilience, we want to cover the disaster cycle starting from preparedness, response, and recovery and mitigation. When we look through the preparedness, so the preparedness you need in order to enhance the resiliency in the preparedness section. So there is risk assessment and identification of hazards. So is needed or on demands to in order to prioritize the risk, you know, your risk. So then you can modify your disaster cycle based on the risk assessment. If you having setting the hazards, or you know your perils, then you are prioritizing your perils. Then you can even making the disaster preparedness plan, and even you can keeping continuous changes or changing the preparedness plan in order to make this plan resilient toward the disaster setting. And also simulation. There are you can have the rule of simulation and training and exercise. So the simulations are sometimes necessary. So now we have with artificial intelligence, you can give many scenarios, and with artificial intelligence, you can show those simulation, even in crowding, for example, if you want to prepare a plan for a crowding. So with the simulation system, you can put many scenarios, and you can put solution, and you see with the simulation how you counter those challenges. And even training and exercise, you can doing some drills and exercise. The resiliency, or even the other component of resiliency framework, is a response. So even we need to make the response adaptable or changeable, depends on the situation. So we can have even drills regarding the coordination between different stakeholders. The challenge that we have different or multi-stakeholders, and we need to make sure those stakeholders are on track, on right track. Communication system sometimes is challenging even in the response side. So we need have to make this communication system adaptable to any changes. Recovery. So recovery post-disaster, if something happens, so we need to have post-disaster recovery and rehabilitation efforts on plan, especially the psychological resilience. We should have even the plan for psychological resilience and mental health support if something happens. Mitigation, we need to make our plan and infrastructure ready if something happens. So the mitigation is a correction for, and I think the ministry of the resiliency is the mitigation to make these either structural or non-structural. I mean the structural, I mean here the structural, the infrastructure, and non-structural, I mean the personnel, and be adaptable for any changes or any measures, and technology can be used, and innovation can be applied to the mitigation by enhancing the either structural or non-structural issues. And there are many case studies can be learned about the resiliency. We can use historical analysis of disaster management in mass gathering. We can look for success stories and failure stories in disaster resiliency. We have stories in Hajj, Olympic, and sport events. So when we look to the Hajj, for example, it's one of the largest religious mass gathering, and usually people are gathered in confined area and highly dense area. So the logistics is complex, and there are many challenges like population density and different health risk on infectious diseases, non-communicable diseases. We have elderly population. We have different environmental factors like heat. So we can get from these success stories, for example, the technological advancement and GPS tracking for the, and we saw our colleagues before they are presenting about the technological advancement in the that can be used in Hajj pilgrims. And also the surveillance system. The Saudi Arabia has a good system, surveillance system for detecting or early detection for the infectious disease, for example, and even injuries. The healthcare preparedness, also the temporary hospital shows some success in the Hajj. The Olympic events, there are various hosting cities, and each cities have capability or capacity sometime regarding transportation, security, and healthcare. So one of the challenges or main challenges is the security risk. Terrorism is one of the vulnerabilities in the Olympic Games, and usually in even the Olympic Games require large scale logistics. So they need different logistic system, and also the environmental risk depends on the location of the Olympics. Some Olympic system, Olympics held in warm cities or with the hot weather. So the heat stroke can be one of the vulnerabilities there. So when we look to the success stories in Athens 2004 Athens Olympic, they have comprehensive security strategies, and they took these comprehensive security strategies post 9/11, and they put plans for the security in order to prevent any intentional actions. And also in London Olympic, they have good plan for crowd control measures, and even London, I will show after the next slide that they have problem with the crowd control in one of the matches. We'll see. And the Olympic game even have the failure in Munich with 11 athletes killed by the terrorist action. So that is a major security that lead to major security reform in the future events. Regarding the sport events, FIFA World Cup and other football matches, 2011 South Africa having held the first World Cup in Africa, and that consider in Africa significant infrastructure challenges, and they have even planned for terrorist threats through the collaboration with the international intelligence system. So, and they succeed in this situation in the South Africa. While in the 1989 in Hillsberg's disaster, there is a match between the Nottingham and Interpol. There are a failure of 97 deaths with 700 injuries due to crowd control. The problem that the attendees coming without tickets and they escaping through corridors and getting the match and causing overcrowd. So this is kind of leading. This is can lead to many cases or many mortalities and morbidities there. In United European Football Association final, which is called the European Championship in 2021. Also, they have a crowd management failure at Wembley Stadium, and this is recent stories. Even there is no mortalities, but it consider failure for the crowd management, and we should see the lessons and the simulation. There are many videos about the simulation regarding the crowd management, and so we can, if we planning in future any football games or sport events, we can taking these videos as a lessons, and we saw where is the failures where is the failure, so we can making the system resilient. COVID-19 pandemic, one of the challenges, and in 2020, there is it lead to postponement or cancellation of events in Tokyo 2022 Olympics. But there are new measures applied. It's called Pew Bubbles. They apply measures called Pew Bubble by isolating the football teams and the staff. They isolated from the other individual in order not getting the infections. And this is a good lesson for health resiliency by enhancing the social distancing while the social distancing was in 2021 and 2022 was on demand to have such events to held. The integration of public health and safety, sometime if we lose the crowd management, for example, safety is a part of crowd management, it can lead to serious health events, injuries, and mortalities. So we need to prepare even to the worst scenarios sometimes by making emergency medical response for the mass casualties if something happened like that. So we need both the emergency medical response to be ready for preparing plans for the mass casualties, and even the safety part, which is the prevention part, is a crowd control in order to enhance the resiliency. Collaborative framework for resiliency we need because we have some time. The governmental and private sector, NGOs, communities can be volunteers, can be shared so that we can be enhancing the international collaboration, and we should put in our mind the public health resiliency or framework of resiliency to enhance the cycle of the disaster cycle, preparedness, mitigation, response and recovery. And this can be by making a good partnership between the health personnel, law enforcement, and emergency response and they should be sitting in the table and putting the framework of resiliency as as a paramount for their actions or their plans. Challenges and future direction. There are many emerging threats, pandemics occurring many times, and now we're hearing about new viruses. So terrorism and climate change, those are challenging and they should be considered for each planning and for enhancing the resiliency by building adaptive capacity and flexibility in response plan, even in preparedness plan. And we should use the technological advancement for enhancing resiliency. We can having many simulation systems for for example, for crowd control, we can be used and utilized in order to prevent these situations. So in conclusion, comprehensive resiliency framework is essential for safeguard mass gathering, and continuous improvement for disaster plan is necessary to adapt new challenges. Thank you.
Thank you, Rectors Al-Badrani. Any questions from the audience for all our speakers? Any questions? Okay, there.
Assalamu alaikum. My question is to Dr. Ghamdi. Do you recommend pneumococcal vaccine for elderly patients who are more than 65 with chronic disease? Thank you.
Yes, it is recommended, the pneumococcal. As you know, the new pneumococcal is, you can take it only once is enough. You don't have to repeat it. So it is recommended, yes, with all patients with underlying pre-existing lung, all pneumococcal vaccine, the new one.
ثانية دكتورة من الحضور any أسئلة؟ أونلاين عندنا أسئلة؟ ما عندنا أسئلة. طيب خلاص موعدنا 1:30 إن شاء الله.
We are more than happy to receive your questions, comments, suggestion, anything, please. Our next speaker, Dr. Abdullah Al-Hussawi. He will talk about simulation of integrated medical services for pilgrims and Umrah visitor using medical centers and telemedicine. تفضل.
طيب اليوم أنا حتكلم بالعربي لأني سويت البرزنتيشن عربي. العنوان اللي هو النمذجة ومحاكاة نظام متكامل لتقديم خدمات طبية للحجاج والمعتمرين من خلال المراكز الطبية وخدمات الطب عن بعد. إحنا فعلا الآن نحتاج طيب هذه الدراسة صراحة يعني من الدراسات المهمة اللي إحنا التمسناها في أرض الواقع. كون معهد خادم الحرمين الشريفين لأبحاث الحج والعمرة موجود في مكة المكرمة. فإحنا يمكن كسكان وبعض الأحيان بنعيش نفس التجربة حقت الزائر أو الحاج أو المعتمر. كيف المراكز الطبية وكيف المستشفيات بتكون فل بوك يعني. وهذه كلها احنا بنشوفها تقريبا وخاصة في الطوارئ. تيجي تلقى الطوارئ مليان يعني 24 hours خاصة في رمضان في الحج أيام الزيارة. ما في هذه كلها أنت بتحتاج سيستم تاني يكون شغال طوال السنة معاك. وخاصة احنا في مكة تقريبا أو في هذه الأماكن نحتاج فعلا يعني حاجة نسميها out of shelves أو حاجة من التقنيات اللي هي موجودة عندنا أو شيء من الذكاء الاصطناعي اللي يساعدنا أو شيء من التقنيات تكنولوجي موجودة نبغى نساعد في عملية تسريع الخدمات. فهذه الفكرة هنا محتوى العرض حيكون في مقدمة هدف البحث مخطط سير العمليات في مركز صحي من خلال الطب عن بعد آلية النمذجة والمحاكاة. هنا استخدمنا نظام افتراضي. احنا دائما أي فكرة احنا نجيبها نقول لك أعطيني حاجة تسوي لي الموثوقية فيها أو حاجات أنا كباحث أقدر أخذها وأعرف إنه فعلا أقول إنه هذه الطريقة اللي أنت استخدمتها فالid يعني كون إنها فكرة موجودة تقريبا في عقل الواحد ولكن لازم أنا أدعمها بتقنيات زي هذه اللي فيها النمذجة والمحاكاة عشان أطلع الموثوقية حقتها وأقول فعلا إنه هذه التجربة ترى تنجح لو طبقناها في هذه الأماكن. فقط أنت تحتاج خلاص تأخذها على الريل كيس وتطبقها. تصميم نموذج المحاكاة نظام تقديم الخدمات الطبية من خلال المراكز الطبية وخدمات الطب عن بعد. إجراءات وتجارب. احنا عاد سوينا عدة سيناريوهات حتى نشوف الكيس هذه فعلا هي فالid ولا نات تقريبا. مثل القياسات ونتائج عملية المحاكاة الخلاصة والتوصيات. طيب احنا هنا عندنا يعد مقدمة. يعد الحج والعمرة من أكبر التجمعات الجماهيرية والأحداث الكبيرة في العالم. يواجه الحجاج تحديات بسبب عوامل مختلفة. هذه السنة إحنا يمكن واجهنا اللي هو الإجهاد الحراري وخاصة يمكن الدراسة اللي عرضها أمس زميلي الدكتور مازن الشمراني أتكلم يمكن عن التحديات اللي واجهت معظم عائلات الحجاج تقريبا بالإجهاد الحراري، الازدحام، الحالات المرضية الموجودة مسبقا، عدد كبير من الحجاج والزوار توفير رعاية طبية بشكل كافي يعد تحديا كبيرا. هذه فعلا واحدة من التحديات اللي احنا بنواجهها خلال فترات الأحداث الكبيرة أو الماس جاذرينج. وأحرز الطب عن بعد تقدما كثيرا يساعد في تلبية المتطلبات الصحية وتقديم المساعدة الفورية خلال مواسم الحج والعمرة. يعمل على سد الفجوة بين كل من المرضى ومقدمي الرعاية الصحية من خلال الاستفادة من التكنولوجيا وشبكات الاتصالات. كون إن هذه موجودة حتساعدنا فعلا إن إحنا ما أخلي الحاج أو أخلي المستفيد يجيني في نفس المكان، لا أنا أقدر أشوف أي طريقة ثانية تقريبا زي اللي أنا بدي أشرح لكم إياها اليوم تساعد في سد الفجوات هذه من خلال تحسين كفاءة وفعالية الخدمات الطبية للحجاج والمعتمرين. وبرضه تقدر تطبقها فين هذه تقريبا في الماث جاذرينج. تطوير نظام متكامل يشمل المراكز الطبية الفعلية وخدمات الطب عن بعد. ما هي فقط اللي هي المراكز الطبية فقط، ولكن حتى المستشفيات أنا أقدر تقريبا أطبق نفس النظام هذا بحيث إنه ما أخلي اللود كله يكون موجود في هذا المركز أو المستشفى. يمكن أن يوفر الحجاج والزوار رعاية طبية عالية الجودة من خلال عالية الجودة في الوقت المناسب بغض النظر عن موقعهم. تشمل مكونات النظام المتكامل المراكز الطبية، خدمات الطب عن بعد، شبكات اتصال موثوقة. الهدف البحث تركيز الورقة البحثية على عرض نموذج محاكاة لنظام متكامل يقدم خدمات الرعاية الصحية من خلال المراكز الطبية وخدمات التطبيب عن بعد. تقييم أداء النظام متكامل، يتم اختبار تأثير إجراءات عدة تعديلات بمتغيرات النظام في سيناريوهات مختلفة. هنا إحنا عندنا سيناريوهات أخذناها وعندنا معايير كثير أخذناها واشتغلنا على هذه المعايير إن هذه هي اللي موجودة في المراكز الطبية، وحناخذ بعضها تقريبا بعد شوية ونعطيكم إياها. يتم قياس تأثير المتغيرات من خلال عدد من المؤشرات الأداء مثل أوقات انتظار المريض. هذه واحدة من التحديات اللي احنا فعلا تدخل بحيان انت بتروح على الطوارئ 5-6 ساعات تجلس هناك، في النهاية هو بيصرف لك بعض الأدوية وتأخذها. طيب إذا كان في نظام ثاني يقدر يساعد تقريبا اخذ العمليه هذه تقريبا في 10 دقائق 5 دقائق مقبوله الى ساعه كامله تقريبا تكون مقبوله. اوقات انتظار المريض، مده بقاء المريض بالنظام، عدد حالات المرضى المفتوحه، النشطه، المغلقه، كفاءه اشغال الاطباء. مخطط سير العمليات في مركز صحي وخلال الطب عن بعد. أنا عندي بيشنت اللي هو في بيشنت انتلم، وبعد كده يكون عندي أنا بيشنت إن وبيشنت أوت في سير العمليات في المركز الصحي. في الجانب الأزرق نشوف إنه سير العمليات خلال الطب عن بعد. أنا أبغى أدمج النظامين هذه مع بعض تقريبا بحيث إنه يكون في عملية إيش؟ توزيع. أول ما تيجي أنا أقدر أحط النظام هذا تقريبا جوة المستشفى، أنا أقدر أخليك تتصل تقريبا وتأخذ الخدمة قبل لا تجيني المستشفى. إذا كانت الكراود عندي الزحمة موجودة جوة المستشفى أنا أقدر تقريبا 3-4 أجهزة، وعندي النظام الثاني اللي بيتكامل معاه تقريبا زي النظام اللي شرحه أخونا اللي هو الدكتور مازن اللي هو الأونلاين اللي هو كان تقريبا فيرتشوال كلينيك. خلاص أنا أحول هذا تقريبا على الفيرتشوال كلينيك تقريبا، والفيرتشوال كلينيك خلاص حتى عنده الاعتماد يطلع الحالات اللي إحنا نحتاجها. عندك ويتنج تايم طويل في عند دكتور معين، خلاص انا احول كل العيادات اللي هي موجوده تقريبا عندي خلاص عن طريق الاونلاين، والخدمات كلها تقدم هناك. خلاص عندي انا بيشنت ان، عندي بيشنت اوت تقريبا، فعندي الفا نسبة من هذول البيشنت أنا أحولهم على طبابة عن بعد، وبعضهم أنا أحولهم على إيش؟ على المركز. خلاص تكونوا أنتم موجودين بالمركز. في بعضهم يكون حالاتهم حرجة الحالات الحرجة، الحالات اللي احنا نشوف يحتاج لها تقريبا عناية أكثر، هي هذه اللي تكون موجودة. أما الباقي تقريبا معظمهم تقريبا خلاص بيحتاج بعض الوصفات الطبية وينتقل من مرحلة لأخرى. المخرجات عندنا احنا بص عندنا قياسات في الموديل اللي احنا سويناه عن طريق النمذجة والمحاكاة، وعندنا مدخلات طبعا اللي هي المدخلات. عندنا احنا المخرجات اول حاجه ناخذ المدخلات، عندنا اعداد وازمنه معدلات. المخرجات عندنا قياسات المؤشرات اللي هي فعلا بتعطينا بعض الموثوقيه في هذا النظام. ناخذ واحده من المخرجات، ناخذ واحده من المدخلات اللي هي البارامترز اوف ذا، ناخذ اللي هو البيشن ادميشن ريت تو ذا ميديكال سنتر. عندنا كمان اللي هو الكاباسيتي اوف ذا ويتنج اريا اللي هي موجوده. عندنا number of the registration in the medical center. عندنا اللي هو the telemedicine service. The number of the physician in the medical center. هذه كلها أنا مدخلات أنا أقدر عدد الأطباء اللي هم موجودين عندي تقريبا، فهذا هو كمان أحد المعيارات. طبيب ما هو شرط إنك تكون موجود، طبيب تقدر أتحكم بالعدد، عندي 2 عندي 3 عندي 5، فأنا أقدر أتحكم بها تقريبا. number of the pharmacists in the medical center، هذه كمان أحد المدخلات. عندي شوية كذا نظر وأشوف كذا يمكن أفضل. number of the telemedicine. بعد كذا الريفير registration time in the medicine center. بعد كذا عندي consulting time in the medicine center and the telecom center. waiting time in the pharmacies. referral ratio. عندي waiting time in the additional examination. بعضهم يحتاج بعض الإكزام، فهذا أنا على طول أحوله لللاب اللي هو بيكون موجود. بعد كذا في عندي مخرجات قياسات المؤشرات. هذا الإفكت of the system parameter variation are measured. عندي البيشن ويتنج تايم، هذه واحدة من يعني كم أنت جلست في المركز أو في النظام اللي أنا سويته. عندي بيشن سايكل تايم which is the total time spent in the medical center or in the telemedicine service. فهذه كمان أنا ماخذها واحدة من المعايير اللي إحنا نقدر نتحكم فيها. أقدر أحط لك وقت معين أنا أبغاك تقدم لي الخدمات في هذه الأوقات. عندنا number of the open action and closed patient cases and physician utilization. هذه برضها كمان واحدة من الحاجات اللي كلنا إحنا تقريبا متفقين عليها في البحث. هنا نموذج تصميم للمحاكاة نظام تقديم الخدمات الطبية من خلال المراكز الطبية وخدمات الطب عن بعد. أول هناك تقريبا عندنا النموذج، بعد كذا عندي مخطط العمليات كيف البروسيس بيصير، عندي شاشة مدخلات السيناريوهات. هذه سويناه بموديلز وماخذين سيموليشن اللي هو اللوجيت. نقدر نتعامل معاه بعدة طرق احنا نشوفها تقريبا، وخاصة في هذا المجال احنا از اكسبرت نقدر يعني نحول العمليات التشغيلية ونسوي لها بعض العمليات التشغيلية نقيسها قبل لا تطبقها انت على ارض الواقع. اي عمليه تشغيليه عندك في مركز صحي في منظومه تعتبر تقريبا منظومه تشغيل، لا احنا حنقدر تقريبا عن طريق النظام النمذجه والمحاكاه نطلع تقريبا نفس الاوبريشن اللي انت بتسويه، ونقول لك شوف هنا لو سويت الحاجه الفلانيه حتحسن، هنا لو طورت، هنا لو حطيت 3 4 حاجات تقريبا حتسرع لك العمليه في المكان الفلاني. فاي عمليه تشغيليه موجوده عندك وات ايفر كانت كبيره صغيره البروسيس كله احنا وي كان ميك بريك داون لها تقريبا عن طريق مخطط العمليات ايش اول شيء، ثاني شيء، ثالث شيء، ايش اللي بيصير. وهنا نبدا نحسن في الفيرتشوال ماشين اللي هو احنا نسميه زي الفيرتشوال ماشين قبل لا انا اطبق الخطه التشغيليه تقريبا حقتي. فخلاص انا هنا كلها لا، انا ادمج هذه الاثنين مع بعض. عندي عمليتين، ليش انت سويت لها سيبريت؟ المفروض اشبكها مع بعض واقيسها واسوي رن للسيموليشن تقريبا عشان يطلع لي بعض النتائج اللي ايش حنشوفها بعد كذا. هذه هنا عندي شاشه مدخلات وسيناريوهات للمحاكاه نفسها، ادخل كل السيناريوهات اللي انا ابغاها. فما اخلي، احنا دائما في علم اداره الحشود اعالجك عن بعد قد ما اقدر تقريبا. يعني باحيان احنا تقريبا لو نقدر ما نخليك تجينا الينا الحرم، نقول لك عرفت يعني انا اعطيك زي اي علم من العلوم اللي احنا تقريبا الان زي العالم الافتراضي، خلاص اعطيك تقريبا حاجه تروح تقريبا تدخلك في العالم الافتراضي ده وتدخلك وتحس نفسك انك فعلا كانك جيت صليت معانا في الحرم. صوت السديس عن طريق ال 3 دي، عن طريق الكاميرات وعن طريق النظارات، خلاص ادخلك نفس المكان تحس فعلا بالروحانيه. عندنا دراسه احنا سويناها تقريبا كانت للحجر الاسود، تلبس النظاره فعلا تمسك الحجر الاسود كانك ماسك فعلا زاير الحجر الاسود، صوت وصوره وفعلا. يعني هنا استخدمنا الذكاء الاصطناعي في هذا الشيء. ولكن نرجع مره ثانيه لنفس الدراسه حقتنا هذه، مخطط عمليات بالنموذج، تسوي كل العمليه التشغيليه حقتك، وهذه الشاشه حقت المدخلات ونقيسها. طيب هنا تجارب، هنا عندنا اجراءات وتجارب سيناريوهات. انا عندي بيشنت ارايف، خلينا ناخذ عندنا سيناريو 1 وعندي سيناريو 2 سيناريو 3 وسيناريو 4 تقريبا. انا عندي البيشنت ارايف الباترن اللي هو الباترن عندي تقريبا انا خلاص هم هذول اللي انا اقدر اتحكم فيهم. انا عندي التيليميديسن ريشو اقدر اخذ تقريبا اللي هو الاس 50%، ولكن انا هنا عندي نمبر اوف ريجستريشن ان ذا ميديسن سنتر، انا عندي 3. عندي اللي هو التيليميديسن في السيرفر عندي 3. عندي نمبر اوف ذا فيزيشن اللي هم الاطباء عندي 9. طيب انا ابغاهم يكونوا 8 5 4، اقدر انا اسوي الحاجه تقريبا على حسب ما هو موجود عندي. خلاص انا اتحكم حتى بالتدفق حق الناس اللي انا ابغاكم تجوني، قد ما اقدر انا اقدم لك الخدمه عن بعد، ولما تيجي هنا تاخذ الخدمه زي ما هي موجوده. يعني احنا دائما في عالم الضيافه ما اقدر تقريبا ايش اعزمك واجيبك الين عندي وما اقدم لك الخدمه المناسبه لك. لا، انا اضمن انه فعلا الخدمه اللي بدها تجيني او بدها تروح تلقاها في الوقت المناسب، في الوقت والساعه والمكان كمان تقريبا. ما حتيجي تلقى زحام، تلقى تقريبا وجز احنا بيسبب لنا الضجر. فاحنا هذه مره ثانيه ارجع للنمبر اوف ذا تيلي ميديسين كونسلتيشن اللي هم موجودين، اللي هم المستشارين اللي موجودين عن طريق النظام عن بعد، عندي 9. فبناء على هذه تقريبا انا اقدر اخذ تقريبا هذه كمعايير لي على حسب ما انا ابغى التدفق حق الناس يجوني، او ابغى اتحكم حتى بالحركه جوه مين؟ جوه المستشفى. خلاص احط 2 3 10 تقريبا، انا ابغاك تاخذ لي 50%، هذول كلهم انا ابغى اقدم لهم الخدمات حقتهم تكون عن بعد. حتى الوصفه الطبيه بيروح على طول يصرفها ويطلع، ما احتاجك تجيني الين هنا. ان جيتني الين هنا كمان بدل ما انت بتاخذ تقريبا 4 ساعات 5 ساعات انا اسوي لك تشخيص اولي، انت خلاص روح على اللايبورتري، ما تحتاج تجلس هنا. لو شكيت انا فين تقريبا انت تحتاج دكتور يشوفك تقريبا، خلاص اجلس في الويتنج. فانا سرعت العمليه حقتي. باحيان في النظام اللي هو موجود عندي عن بعد، اللي هو عن بعد، ما عندي احد، انا مضطر اجيبكم هنا. ما عندي احد، عندي تقريبا زحمه في الفارماسيز. ليش؟ لانه الاطباء الفارماسيز اللي هم موجودين اشتغلوا 14 ساعه 16 ساعه، الكباسيتي قلت، فاكيد ما حيديك الخدمه اللي انت تحتاجها. وكذلك حتى الدكاتره اللي هم موجودين، احنا بنشوف دائما في وقت الذروه بيشتغل تقريبا اكثر من 16 ساعه. يعني حتى الطبيب بعد 16 ساعه صعب يعطيك الوصفه اللي احنا يعني بتروح لدكتور بعد 16 ساعه، حيكون مجهد، حيكون تعبان. فعلا. فانا احط له باك اب بلان تقريبا، تبغى تتعدى، تبغى تاكل، حول لي بعض البيشنت هذول يروحوا على فين، على التلي تقريبا، نظام اللي هو عن بعد تقريبا، والامور كلها تقريبا تلقى المركز ماشي، لا العميل وقف ولا المركز وقف ولا النظام عندك ماشي، وحسن لك الجوده. هنا السيناريو 2 احنا اخذنا زي 30 50 70 80. السيناريو اللي بعده اخذنا 70%. 70% انا هذه كلها انا اقدر اتحكم فيها. ما عندي تقريبا هنا، انا قمت لعبت في الفيزيشن اللي هم ما عندي الا 6، اول شيء 9، بعدين 3، بعدين 5، بعدين 12. ففي اوقات تقريبا في الليل ما عندك ناس كثير، في الظهر اوقات الذروه ما عندك العدد اللي انت تحتاجه. فهنا تديك عمليه التوزيع بين الايش، بين الريل اللي هو موجود عندك وبين النظامين اللي اقترحتها هذه الورقه. اجراء تجارب سيناريو المحاكاه هنا بيديك هذه هنا كان فيها زي الفيديوهات موجوده تقريبا توريك الحركه لايف، كيف كل مؤشر بيتحرك تقريبا، وكل مؤشر كيف تقريبا بيقيس النظام. هذه الالوان، هذا المؤشر تقريبا بيديك زي المعدل، ولكن هذه كلها في الفيديوهات اللي احنا ارسلناها كانت كده تشوفها كلها بتتحرك لايف تقريبا. فاذا كان في اي مشكله تقريبا فحيطلع لك اياها، يقول لك شوف المشكله تحصل لك بعد ما النظام عندك يوصل ل 10000 ل 15000 بيشنت. فاذا انا اعرف متى البريك اللي انا اصلا نقطه الانهيار حقتي موجوده عندي في النظام. هنا مثال قياس نتائج عمليات المحاكاة، برضو هذه بعض النتائج في S1 و S2 S3. إن قللت هنا هذا زاد، إن زاد هذا نقص. فهذه هي نتائج هذه الأرقام. هذه الخلاصة تقريبا. تم عرض نموذج محاكاة لنظام متكامل يقدم خدمات الرعاية الصحية من خلال المراكز الطبية والخدمات التطبيب عن بعد. مكونات النظام متكامل تشمل مراكز طبية، خدمات طب عن بعد، شبكات اتصالات، ويعمل على تمكين المستفيدين بغض النظر عن مواقعهم من الاستفادة من الرعاية الطبية بسرعة وجودة عالية من خلال هذا النظام. تمكين مقدمي الرعاية الصحية من التشخيص وتقديم المشورة للحجاج دون الحاجة إلى القيام بزيارات فعلية للمستشفيات أو العيادات. تحسين استخدام أدوات ومواد الرعاية الصحية من خلال تقييم مختلف السيناريوهات لمحاكاة وقياس المؤشرات الرئيسية لأداء مثل أوقات الانتظار للمرضى وأوقات الذروة واستخدام الأطباء. ويظهر بوضوح أن النظام المقترح يمكن أن يعزز بشكل كبير تقديم خدمات الرعاية الصحية خلال هذه التجمعات الضخمة. أظهرت نتائج المحاكاة أن استخدام مثل هذه الأنظمة المتكاملة يمكن أن يضمن تعزيز تدفق العمليات وتحسين الموارد، وبالتالي ضمان التعامل بفعالية مع الطلب الكبير على الخدمات الطبية خلال مواسم الحج والعمرة، وأيضا خلال التجمعات الكبيرة. هذه بعض التوصيات. ضرورة التوسع في خدمات الطب عن بعد في أنظمة الرعاية الصحية، توفير خدمات طبية فعالة للمعتمرين والزوار. المساهمة في تعظيم الاستفادة من الخدمات الرعاية الصحية، تحسين مستوى رضا المستفيدين من ضيوف الرحمن. ضرورة زيادة الاعتماد على أدوات النمذجة والمحاكاة في تحسين كفاءة العمل بالمرافق الصحية. تساعد المحاكاة في تحديد نقاط الضعف والمجالات التي يمكن تحسينها. إمكانية إجراء أو اختبار سيناريوهات وإجراء تعديلات دون التأثير على العمليات الحقيقية. إمكانية تحسين تدفق العمليات وتقليل أوقات الانتظار وتحسين استخدام الموارد. أهمية إنشاء بروتوكولات وإرشادات موحدة لخدمة الطب عن بعد لضمان تناسق جودة خدمات الرعاية الصحية. أهمية تحديد مجموعة مؤثرات أداء مثل أوقات الانتظار، كفاءة استخدام الموارد من أجل تقييم وتحسين أداء النظام. يمكن استخدام النموذج المقترح كعمل مستقبلي لإيجاد حلول مثلى لاستخدام الموارد المتاحة في الوقت نفسه وتوفير الخدمات الطبية بشكل مرضي. أي أسئلة؟ أي أسئلة؟ تفضل. مازن.
شكرا دكتور عبد الله for your nice presentation. سؤالي المحاكاة هل أجريت على مركز صحي في مستشفى أو على مستشفى موجودة في مكة، بحيث إنه الواحد يقدر يشوف هل هي applicable أو إنه لو نحسن من الأداء، لأنه المؤشرات جيدة بس الكلام المحاكاة هل عملت كتجربة حقيقية على أرض الواقع؟
ناخذ الخطه التسجيليه حقتكم ونحطها. احنا لو اخذنا اي بيانات، احنا لو جاتنا بيانات حقيقيه فعلا من اي مركز حنقدر ناخذها وحتى نعطيه الخطه كيف انت حتدير المركز ده. ان كانت مستشفى حنديك الخطه كيف انت تقدر تدير المستشفى بحيث انه يكون فعلا فيرنس للاطباء مجهدين والخدمات مشيت بطريقه ما يجيك الا اللي فعلا انت عندك وصفه تروح لللابورتري، انت عندك بتروح للدكتور الفلاني، انت تحتاج تروح على طول للطوارئ. فناس لو جوك عند المستشفى تقدر تقريبا. احنا هنا السيستم سويناه على طول انه على فيه له نظامين. ففي الفكره الثالثه انه يكون عندك كول سنتر موجود تقريبا، خلاص يبدا ياخذ منك الاعداد تقريبا، وحتى هو يدخل معاك عشان يسرع لك العمليه كلها تقريبا. ما جيت انا اقول لك خلاص اوجهك على المركز اللي موجود في المكان فين موقعك انت، انا موقعي في المكان الفلاني في النقطه الفلانيه، هيا روح للمكان الفلاني اوريدي انت بوكت خلاص موجود، بتروح ياخذ دم من عندك تقريبا وتروح وتجيك النتيجه حقت الدم، وحتى الروشته كمان اقول لك روح خذها من الصيدليات الان اللي هو بيصير. ان كان يحتاجك يقول لك لا ارجع لي مره ثانيه انا اشوفك. فهذه فعلا حتكون يعني سهله لمدراء المستشفيات، إدارة المستشفى، إدارة المركز نفسه. إن جاتنا بيانات حقيقية إحنا ما عندنا مشكلة نساعد حتى نسوي فاليديشن في عملية تسيير الأمور في هذه المراكز أو المستشفيات. سؤال ثاني؟
Any more questions, please? Okay, thank you very much. Dr. Hosawi, thank you. Now our last presentation will be presented by Dr. Ahmed Al-Afghani. He will talk about infection control measures and containing plans for outbreaks. تفضل دكتور.
السلام عليكم. يعطيكم العافية جميعا. Today, inshallah, this is our last lecture. I hope you are still enjoying. Mass gathering has attracted the attention of the medical community owing to the numerous factors, including the sudden increase in the demand made on existing services and the potential for public health emergency resulting from changes in the population dynamics and behaviors. In addition to the necessary knowledge of the geography and locality of the mass gathering regarding prediction of the possible occurrence of endemic diseases, it's important to have early detection of outbreaks. The detection of outbreaks in mass gatherings could be enhanced by syndromic surveillance of diseases occurs in the attendees. Let's go through some of the basic definitions of infection control. We have the sporadic, which is mean a disease that occurs infrequently and irregularly. Endemic, the constant presence and or usual prevalence of a disease or infectious agent in a population within a geographic area. Epidemic, an increase often sudden in the number of cases of the disease above what is normally expected in that population at that area. Outbreak carry the same definition of endemic, however, used for a more limited geographic area. Pandemic refers to epidemic that spread over several countries or continents and usually affect a large number of people. Infection control in mass gatherings. Infection control are critical in prevention of outbreaks occurrence. Those measures and protocols are established according to the local health authorities and global health organizations' collaborations. After establishing the risk assessment and characterization, mitigation plans are placed to control the outbreaks. The international health regulations are the main legally binding global agreement that addresses the coordinated global risk management of acute public health events. Here are examples of risk characterization on both mass gathering and public health. Let's start with minimal, like little or no consequences or disruption to the mass gathering, while in public health, it has little or no consequences. And going through it till we reach severe, impacting the mass gathering that cause cancellation or significant adverse impact and lost reputations. For the public health, it can cause substantial loss of life and serious injuries or illnesses and widespread of disruption of local services and infrastructures. Every country should carry out a risk assessment of public health events that take place within their borders. The international health regulations reinforce the WHO's involvement in a collaborative risk assessment and support response activities to public health events when requested by the country. Response activities can include WHO providing technical guidance, assisting control measures, and mobilizing field team for risk assessment, clinical management, investigation, or disease control. Stakeholders' engagements are crucial in organizing different involved parties that play a role in containing plans of outbreaks. Here are examples of the stakeholders and their levels. We have first the government or board committees. Then we have the health steering group or committee. Then going through public health, health services, resiliency, and cross-cutting issues, and the last working groups like surveillance teams, food safeties, EMS, etc. Command, control, and communication. Establishing those three procedures as soon as possible during the planning process. This can be written down in the form of concept of operation documents, reviewing the business as usual arrangement and use mass gathering context and risk assessment to inform any required changes, obtain the governmental support and legal arrangement. So these can be either during the risk assessment or after happening the outbreaks. Health promotions and public information. There is limited published information on the impact of health promotions on mass gatherings. However, there are common themes regarding the use of health promotion and minimizing the risks to health and the use of mass gathering setting as an opportunity to secure and focus resources to promote health and well-being among the local population. For example, smoking cessation, adequate personal hygiene and etiquette, etc. Health promotion is an approach to prevent harm from illnesses or injury and mitigate the impact on health and well-being during mass gathering. Here are examples of health risks identified in the literature and health promotion response. For example, regarding the health risk here, extreme weather as an infectious risk. The evidence-based meditation is warm, covering the skin and cooling and increasing the salt intake and fluid replacement and etc. For the examples of health promotion response implemented, anticipating the weather extremes, water misters attached to the high velocity fans and air conditioning in bus used as a cooling stations, and so on. Here for the infectious diseases, for example, let's take the gastrointestinal. We have the evidence-based mitigation. It is food hygiene and individual hand hygiene and avoiding undercooked food and surveillance for the stations that serving foods and infection control measures. The next is mass gatherings as an opportunity to raise the awareness and promote the reinforce healthy behaviors among individuals and communities. Utilizing mass gatherings are and settings in which to reinforce healthy behaviors among the residents and attendees is a concept that has not yet been fully exploited by the mass gathering plannings. However, there is an evidence of positive healthy impacts of mass gathering and their potential to support healthy behaviors and mental well-being. Disease surveillance and outbreak response. Successful surveillance help and appropriate response during the mass gathering will ensure long-term planning, integration, and involvement of all stakeholders. Clear lines of communication and adequate time to test all of these prior to the event. Surveillance system must be sensitive enough to detect potential public health events at a timely manner. Following the same principles of outbreaks response as they would be in a non-mass gathering settings. However, with the greater political and media interest, populations on the move, and the potential for greater numbers of people exposed, response need to be rapid and comprehensive. Here are two examples of surveillance data during a mass gathering with the response. On the left, we have any signal from case-based surveillance, like number of patients presenting with a particular syndrome exceeds the statistical threshold or what is expected, with increased above baseline numbers of laboratory confirmed cases of a disease. And on the right, we have any reports from events-based surveillance, like media reports of the illness cluster in a region where a mass gathering occurring, health center reports an illness cluster at a mass gathering venue, international report of infectious disease outbreak, country where the mass gathering attendees originate. Initial verification and investigation of the delivered informations. If it is inaccurate report or false positive signal, then no action to be taken. If it is accurate report or real signal, then risk assessment to be immediately initiated and scheduled with multidisciplinary meeting, depending on the urgency and the amount of the risk exposure. Does this have a potential impact negatively on mass gathering? If no, no further action required, and record for the proper purpose of the system evaluation. If yes, then record as event situation report and take appropriate public health actions. Preventing and controlling infections measures should be considered in the pre-event advice, like hand and respiratory hygiene, early detection and isolation of cases, vaccination or post-exposural prophylaxis, social distancing, and in some rare cases, use of quarantine. Postponement or cancellation of the event, requesting that certain people do not attend, those more likely to have a severe or fatal illness, should be considered depending on the nature of the infectious risk. Early detection and treatment of cases to reduce the probability of passing illnesses into others can improve the outcome for cases by ensuring appropriate care is provided in a timely manner. Contact tracing of those exposed to the source of infection or case in order to provide advice, immunization, and/or prophylactic treatment. Identification of the source of infection so the control measures can be implemented and monitored accordingly. Immunization or vaccination for vaccine preventable diseases, pre and post exposure, are cornerstone for any outbreak prevention. Other important factors, those include environmental, health consideration, capacities, systems, and structures. So you don't host a large mass gathering that might exceed the capacity of the geographical area or building. Same as well for systems like water, ventilation, and sanitation as well. Protection of the food and water as playing major role of infection transmission, as we explained in our previous lectures. Event medical services, most of the time you need to expand your medical services during mass gathering as infection control measure in pre-outbreaks risk of assessment. Future research for consideration. So whenever you have outbreaks, you may establish researches to learn how to contain them in the future, or similarly to them in the future, with appropriate actions taken from the current outbreak or the previous outbreak. And that's all. And anyone have a question?
Thank you, Dr. Ahmed. Any question, please? تفضل يا دكتور.
Thank you, Doctor. I have a suggestion for Dr. Muhammad and for the high authority. Since we are dealing with a gathering, which is a huge international gathering, one of the ideas to utilize the technology nowadays as application for the visa for coming for Hajj and Umrah, if we are able to take also a history about that who coming to Saudi Arabia. Is he bronchial asthma, ischemic heart disease, hypertensive, diabetic? So if we have that data in our system, that will help the people who is dealing with this patient when he arrived to hospital of the primary care center to be easy. Instead of starting from zero, we have start from back up. So if we transfer this suggestion to high authority to be applied year by year, it will be helpful, I think.
Agree with you. I think this is very excellent. We are lucky that we have two senior and the custodian of the two holy mosque for research for Hajj and Umrah. They are with us. And I think this is very important. But we should have this data from their country, because, you know, they are coming from Egypt, from Africa, from anywhere in the world. But they have to provide their data. And sometimes it is really difficult. They will deny any disease, any chronic disease, because they may decline or they refuse their visa application. ولكن إن شاء الله بإذن الله I think this is a very good idea. صح ولا لا؟ ها؟ and this is their future يعني plan. Okay.
Ministry of Hajj is planning to have a health record for each visitor from Hajj and Umrah. So it will be entered from his country, all these conditions, especially people who are over 55. It's mandatory to make some basic readings for that. The authorities here will find it helpful to recover any health issues faced by the patients.
I think this suggestion, which I have a plan in my mind, that if we start with a modern country, like a patient or arrival coming from United States or Europe or Malaysia, who have the data, if we start with them, then we can apply it for the other countries.
Yes, true. I think Malaysia is one of the advanced Islamic country in the Hajj system. So inshallah, soon through Nusuk platform will be provided, inshallah.
Thank you very much, Dr. Walid, for this. You have any comment, Dr. Abdullah?
بالنسبة لسؤالك يا دكتور، كنا في ورشة عمل مع وزارة الصحة ممثلة في برنامج خدمة ضيوف الرحمن.
صوتك ارفع صوتك.
ممثلة في برنامج خدمة ضيوف الرحمن. طرحوا فعلا هذه الفكرة، وناو اندر بروسيجر، يعني تقريبا بيشوفوا ايش الآلية انه كل حاج قبل لا يدخل المملكة العربية السعودية يكون مقدم على تيست، بلاد تيست تقريبا. والبلاد تيست هذا حاطين فيه بعض المعايير اللي هم يبغوا يكون موجود فيها. واجهتهم مشكلة في اللابوراتوريز اللي هي في العالم كله. بيقولوا هذه واحدة كانت من التحديات، كيف نلقى تقريبا وكيف حنسوي لهذول الناس هذا التيست كوست. يعني بعض الدول ما عندها نفس المراكز الصحية بهذه الكفاءة، بعضهم ما عندهم المعامل اللي تطلع الداتا والبيانات، لازم يخرج من قريته أو من مدينته ويسافر لدولة ثانية. فإتس واحدة من الأهداف اللي حاطها فعلا برنامج خدمة ضيوف الرحمن بالتكامل مع وزارة الصحة لتجويد هذه الخدمات تقريبا.
Excellent. Thank you very much. Any other question? Any comment? Any suggestion? طيب يعطيكم العافية. Thank you very much. وإن شاء الله نراكم في المرات القادمة وبالتوفيق إن شاء الله. في أمان الله.
في أمان الله.